Thank you. You may be seated. Honorable delegates, before we proceed, I would like to make the following announcements. The hybrid sitting constitutes the sitting of the National Council of Provinces. Delegates in the hybrid sitting enjoy the same powers and privileges that apply in the sitting of the National Council of Provinces. For purposes of the quorum, all delegates who are logged onto the virtual platform shall be considered present. Delegates must switch on their videos if they want to speak, and they should ensure that the microphones on their gadgets are muted and must always remain muted unless they are speaking. All delegates in the chamber must connect to the virtual platform as well as insert their cards to register on the chamber system. Delegates who are physically in the chambers must use the floor microphones. All delegates may participate in the discussions through the chat room, and the interpretation facility is active. So all delegates and representatives on the virtual platform are requested to ensure that the interpretation facility on their gadgets are properly activated to facilitate access to the interpretation services. Permanent delegates and members of the executive in the chamber should use the interpretation gadgets on their desks to access the interpretation facilities. Honorable delegates, after I have said that long story, let me greet you all and inform you that in accordance with Council Rule 2291, there will be no notices of motion or motions without notice. But before we proceed, I would like to take this opportunity to welcome the ministers from the Social Services Cluster, specifically the Minister of Social Development that is with us here, Honorable Zulu, and then also the Minister of Health that is on the platform, Honorable Pasla. Furthermore, I would like to remind delegates that in terms of Rule 229 of the Council rules, the time for reply by the Minister to a question is 5 minutes. Only 4 supplementary questions are allowed per question. A member who has asked the initial question would be the first to be afforded an opportunity to ask a supplementary question. And the time for asking a supplementary question is 2 minutes, and the time for reply is 4 minutes. The supplementary question must emanate from the initial question. Honorable members, you are more than welcome, and we will now call on the Minister of Health to respond to questions as asked. And the first question is asked by the Honorable M. Gillian, and it is question number 139 on the question paper. Honorable Minister, it's over to you, and you've got 5 minutes to respond to that question.
Thank you very much, Honorable Chairperson of the session. Good afternoon to honorable members of the NCOP, and afternoon also to my colleague, physically present, Minister Zulu. Thank you very much to the honorable member for the question, which relates to the impact of load shedding on our hospitals' ability to perform services. Honorable members, the National Department of Health has identified, working together with our colleagues, MECs and the HODs of provinces, a list of priority health facilities. And this has mainly been priority hospitals, because as you know, hospitals operate on a 24-hour basis, whereas in as far as other health facilities, that is clinics and community health centers, not all of them give a 24-hour service. So we have prioritized hospitals in all provinces. A list of this was consolidated, and we put together a team together with ESCOM to prioritize these health facilities so that they can be shielded from load shedding. So this list was then discussed in a joint meeting where we have formed a joint committee between ourselves, led by the Director General of Health, Dr. Buthelezi, and also from the head of generation from ESCOM. to process this and make sure that these health facilities can be prioritized for exemption. So we having looked at this in the first week, that was just over 4 weeks ago. In the first round of this prioritization, a number of 37 hospitals were able to be put on an exemption status so that they could be protected from load shedding. In the discussions, it became clear from the technical side of things that some of our facilities are supplied directly by ESCOM itself. They've got a direct line of supply from the nearest ESCOM power station and then, or substation, let me say. But then others are supplied through municipalities. There are municipalities, especially metros and some districts, which are either have entities of their own which supply electricity or maybe directly through the municipality department itself. So what came out of that analysis with ESCOM was that those facilities which are supplied directly by ESCOM can be secured much quicker because ESCOM, is in charge of the direct supply. But those which are supplied through municipalities and their entities, there would need to be some work to be done, working with those municipalities to make sure that the line from the municipality to the health facilities can then be secured, separate from businesses and households in that locality. So at the first round, we're able, working with ESCOM, to get 37 hospitals nationwide to be secured. The team has been meeting on a weekly basis, looking at all the facilities which have been submitted. And as a result of that, as of early this week, there were now 72 health facilities which are now secured from load shedding. Over and above this, we are now also prioritizing that in the coming financial year, all our health facilities must start having plans to put alternative energy supply through solar power, batteries, and any other alternative source of electricity supply. So, but also we have said that for all the new projects of health facilities, whether it be clinics, health centers, hospitals of all grades, we must include in the planning also alternative electricity supply. So these are the interventions, and on a weekly basis, these are being, the number of hospitals which are being protected are going to be increasing. Thank you very much, Honorable Chair.
Thank you very much, Honorable Minister. The first follow-up question will be asked by the Honorable Gillian. Honorable Gillian, you may continue.
Thank you, Chairperson, and greetings to the Minister. Thank you, Minister, for your comprehensive response to my question. The rollout program that will be a permanent solution to the energy problem in the health facilities will obviously take some time. What is the short-term plan to deal with load shedding in the facilities? Thank you.
Thank you, Honorable Gillian. Honorable Minister.
Thank you very much, Honorable Chairperson and Honorable Member. What we're realistic about is that providing alternative power supply. As we talk about alternative power supply, let me just emphasize again that all our 24-hour service and even some of our clinics which are not providing 24-hour service have generators, diesel-powered generators. Now, all our 24-hour facilities, in other words, all hospitals are required, and we do have generators, and we do inspect to make sure that the generators are functioning. working with our colleagues, there's a process through which this is taken as a non-negotiable. So, but in addition to that, we are aware that, so with this more regular load shedding and over prolonged periods, sometime with stage 6, which can take up to 4 hours, those generators are also getting quite stressed. They are under severe strain, even in terms of diesel consumption. So we're prioritizing, as a matter of emergency and urgency, the securing of a separate line so that the ESCOM grid can go, and even where there's a supply through municipalities, there should be this idea of separate line to the health facility. That's really our top priority. But over and above that, as a matter of immediate urgency, making sure that all our facilities, their generators are functional, they have enough diesel supply. Some of them have already indicated that because of the severity of the load shedding, they are already running short of their budgeted diesel supply. So we're working with them to secure more funding, either through reprioritization within health, but also we're discussing the matter also with Treasury, so that where the funds are quite stressed, we could also ask for additional funding. So those are the immediate interventions to make sure that our facilities should never be unable to provide key, especially emergency service, as a result of lack of electricity power. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. Honorable Nana, the next follow-up will be from you.
Thank you very much, Honorable Deputy Chairperson of the NCOP, and good afternoon to honorable members. Well, Minister, I would like to invite you to Grahamstown. There is a 24-hour facility in Grahamstown, which is not too far from where I stay. More often than not, you will find that facility without electricity when it's called Settlers Hospital when there is load shedding. As you probably know, Minister, that I am from the Eastern Cape, and in the Eastern Cape, there are secondary institutions that are actually not exempted from load shedding, like Cecilia Makiwane in Mtatsane, Victoria Hospital in Alice, and many others in our province. These hospitals are a main healthcare facility for many people in and around the disadvantaged areas in the Eastern Cape. I do get your point, Minister, that you are treating this matter as a matter of urgency, but I think it's appropriate on your part to give us tangible answers as to at what point would such institutions that I've mentioned above be fully equipped to operate under this scourge of load shedding without really compromising people's lives. Thank you very much, Deputy Chairperson.
Thank you, Honorable Nana. Honorable Minister.
Thank you very much to the Honorable Member and Chairperson. I will definitely make a follow-up as we leave this session to check on what is the problem at Settlers, because as I said, our immediate fallback is always making sure that there is a functional generator at every 24-hour facility, and a hospital for that matter is very top priority. So we will be able to check on that. I'll get our infrastructure team working with the Eastern Cape Health Department to indeed follow up on this. As a matter of fact, as I've indicated, our team, which is led at the highest level, the Director General, the Chief Financial Officer, the Head of Infrastructure, and I've also instructed them that they should, in their weekly meetings with ESCOM, they also need to make sure that in each province, we establish hospital by hospital, what is the line of supply? Is it from a municipality? Is it from ESCOM? And follow up on each one of them, so that instead of generalizing, if we say Settlers Hospital in the Eastern Cape, we must know on our fingertips, is it supplied by the district? Is it supplied by the local municipality or is supplied by ESCOM? And whoever the final authority who provides the feed into the hospital, our team working with the province, in this case, Eastern Cape, and ESCOM and the immediate supplier must actually, come with very tangible timelines. If there's need to be a separate cable to be installed, that must be done so that our facilities can be secured. I want to assure the honourable member that I'm reviewing as we speak each province, the hospitals which are exempted, those which are not exempted, so that we can have timelines, especially your key facilities such as a big facility which serves millions of people, such as the Cecilia Magiwane Hospital in Buffalo City. Those are top priority for us. So I am reviewing as we speak for each province, which are some of those hospitals which are not yet secured, and we'll be making sure on a weekly basis I get an update. Thank you very much.
Thank you, Honorable Minister. The next follow-up will be from Honorable Arnold.
Thank
Honorable
you.
Arnold, order. Begin weer.
Thank you, Deputy Chairperson. Minister, state hospitals do not have sufficient backup energy generating capacity to maintain essential equipment like incubators, respirators, lighting, and air conditioning. Which alternative measures have been taken in the short and medium term regarding those public health facilities which have not been exempt from load shedding, as a result are not well prepared to deal with the power cuts? And does the minister agree that you and your department must be held liable for any lives lost due to not resolving this emergency? If not, why not? If so, who should be held accountable? Thank you.
Honorable Minister.
Thank you very much, Honorable Chairperson. Indeed, the idea of the backup generators does not start now, because even without load shedding, there are other situations where power supply, either due to local conditions or any other, power supply interruptions. That's why for a hospital, it is mandatory to have a backup generator. Now, as to the capacity, of course, we know that generators are not of equal capacity. So as to what extent for each institution, what operations can be carried when the emergency power supply kicks in. The main idea here is that there should not be interruption of key life-saving operations. For example, it may be that things like maybe laundry, sometimes certain amount of energy consuming activities such as certain amount of cooking may be disadvantaged when the generators come in, but they are meant to have enough capacity to sustain the key life saving. So activities such as your operating theaters, your ventilators, your incubators, those ideally should be secured when an emergency generator does kick in. So if honorable members are aware, and we will be checking also with our colleagues who are managing various hospitals, where we can find that the capacity is not good enough, we'll have to work with those institutions, even if it means double the capacity of the generation, even if it means add additional generators to supply certain components of the health facility. So in the immediate, we don't have any other alternative except to make sure either we get that facility secured from load shedding. If not, then we must increase the capacity of the alternative generation supply if the existing emergency standby generators are not strong enough to sustain key essential activities within a health facility. Thank you, honorable members and chairperson.
Thank you, Honorable Minister. Honorable Hadebe, you will be the last on question 139.
Thank you, Honorable Deputy Chairperson. Honorable Minister, it is reported that the department has provided ESCOM with a total of 212 priority hospitals across the country to be considered for possible exclusion from load shedding on a phased approach. And 67% of them are supplied directly by municipalities, while ESCOM supplies the remaining 33%. Whether you're able to verify if this agreement with ESCOM is set in place for the duration of load shedding until the problem is overcome, or will the department need to ask for yearly exemption? Thank you, Honorable Deputy Chairperson.
Thank you, Honorable Hadebe. Honorable Minister.
Thank you very much, honorable member. Yes, indeed, as I've indicated earlier on, we arrived at those numbers of health facilities based on a prioritization. Ideally, we would like all our health facilities to be exempted, but being realistic that this is going to be a phased approach, we had to ask our provinces to prioritize. So we have arrived at those. We do have the lists and the names of the prioritized, and every time a hospital is secured, we're able to know that this is what is now left in terms of the high priority. So on our weekly assessment and review, we go through that and we make sure that the numbers are increasing every time. And we also are aware that in some cases, we have been made aware that there are going to be some equipment which will have to be purchased, and so some funding is required to make sure that some of the facilities can indeed be secured. So those are matters which we're looking at the details with ESCOM, with the municipalities, to make sure that where there are particular inputs which needs to be made, we should be able to do that. Some of those, if it's very costly, they may not be able to be done immediately, but we need to have time frames to make sure that, so indeed what the numbers we have alluded to, so we're giving very high priority to get those done as early as yesterday, in terms of especially those which are directly under ESCOM supply, so that but at the same time identifying the municipalities which are very key. For example, in your Johannesburg area, your city power and all the cities, metros, for instance, do have their electricity supply divisions. So we're working with them to make sure that all the challenges can be addressed. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. Before I continue, I just want to advise the members of the committee, it would be very much advisable for us to have that list of hospitals that are being exempted, so that we can know in your constituency whether your hospital is part of that. And before I continue, I believe Honorable Christians is celebrating her birthday today. Since she didn't inform us, we are not going to congratulate or say anything. We just want you to know, take note that it is her birthday today. Happy birthday, Honorable Christians. So thank you. We will continue. The next question is 154, as asked by Honorable Baha, and we will give over to the Minister to begin with the reply. Over to you, Honorable Minister.
Thank you very much, Honorable Chairperson. Honorable Baha wanted to know about an injectable treatment which can be used to save lives in terms of prevention of HIV and AIDS, as to what we are doing in this regard. The answer, honorable members, is that this injectable product, which is in medical terms called carbodigravar, and for short is called CAP-LA. Now, it's a long-acting injectable which can be offered as an additional prevention tool for people at substantial risk of HIV infection, preferably as a part of a combination approach to the prevention of HIV. Now, the World Health Organization guidelines has given guidelines which recommend that it must be, as I've said, used in combination for pre-exposure prophylaxis. So currently it's not recommended for treatment, but for prevention, which is also very important. But it's recommended that it be used in combination with other measures, such as the dapivirine ring, and also as part of comprehensive prevention. So what we preach is that in prevention, the ABC, which we have been preaching, abstain when, especially for younger people, until you reach your real maturity, that is important. Be faithful, condomize. So condoms still remain very key in the prevention, but this is just one additional tool which you know is going to help us quite a lot. So from our side, we are awaiting an assessment by the South African Health Products Regulatory Authority, SAPRA, and also a team within a specialized team of experts, which advises us on the use of various medicines. This is called the National Essential Medicines List Committee, NAMLEC for short, which advises us on key medications which we should have in our facilities as a priority. That committee is also looking at this cabotegravir, or CAP-LA for short. But the key issue here is, although it's already used in other countries, for it to be used in South Africa, it has to be approved by SAPRA. So we are awaiting approval by SAPRA. Once that approval is given, then it will make it possible for us to start negotiating with the suppliers to make sure that we can enter into agreements. But we must also just indicate to honorable members that currently, the current cost is quite steep. So once the approval is given, we will also work with our experts and also civil society organizations, which have a huge interest in this area, to put pressure on the manufacturers, the pharmaceutical companies, to make sure that the current price can be reviewed. And in this regard, we're also talking to our colleagues in the World Health Organization to put more pressure so that the price can also be reviewed, so that when approval is given by SAPRA that it's safe, they've assessed, they've looked at the data, and it is safe, then we can be able to make this available. There are many members will be aware that there are many other medications, life-saving, which are still very expensive, especially if you look at cancer medication, and this also falls within that currently. And we hope that once the approval is given, we can be able to negotiate lower prices so that we can be able to make this available. Thank you very much, Honorable Chairperson and members.
Thank you, Honorable Minister. The first follow-up will be by Honorable Baha.
Thank you, Deputy Chair, and thank you, Minister, for your response. Minister, for me, the main concern is around the fact that during the COVID-19 pandemic, it seemed as if we have forgotten about other health issues that we are confronted with in the country. And it's encouraging now that you are telling us that this is receiving consideration from our government. But having said that, Minister, having considered this as a treatment or as an alternative to combat fatigue, which causes a huge negative impact on HIV patients, would you then be able to tell us as to what would be the timelines for the completion of the study and research that is being done for this to be implemented and availed to South Africans. Thank you, Deputy Chair.
Thank you, Honorable Baha. Minister.
Well, thank you very much, Honorable Member, Honorable Chairperson. Honorable members, as you would be aware that our legislation protects the South African Health Product Regulatory Authority to be, independent in terms of its operations. They do report to the Minister of Health in terms of governance and compliance with, public regulations, Finance Management Act, governance issues. But in terms of their operations, they are protected to make their own evaluation of the products without any fear or favor, without any pressure. Nevertheless, because when we talk about life-saving medications or injections like this, we have an interest in terms of the service to our people. The health department is allowed to can also make representation in support of requesting a speedy evaluation of this kind of medications. So our team, which is focusing on HIV prevention, will make submissions to SAPRA in support of a speedy consideration of this form of treatment, which can make a lot of difference in improving our prevention of the spread of HIV and AIDS, especially amongst the young, very sexually active population. So, but in terms of how soon that will be done, it's almost impossible for us except to assure members that we will add our voice in terms of appealing for speedy consideration. SAPRA has particular processes in terms of the data which they need to review in terms of whether a particular medication firstly is effective, and then secondly, very key, the issue of safety, that it can be safely used. So, but once all those matters are sorted out, simultaneously, let me say, not only when it's sorted out simultaneously, we are also engaging on the sticky issue of price, so that once all those matters are resolved, we can be able to make this available. I want to assure honorable members that indeed we are now trying to get back into lost ground in terms of our broader mandate of prevention of disease and early detection and treatment. Thank you.
Thank you, Honorable Minister. The next follow-up will be from Honorable Ndongeni. Honorable Ndongeni is on the virtual platform.
Thank you, Deputy Chairperson. Thank you, Honorable Minister, for the responses. While understanding that the department will not put the pressure on the SAPRA to finalize their process of approval, CABLA will definitely assist as an additional HIV prevention option. My question is, what is the department doing to facilitate the process to finalize approval? Thank you, Deputy Chair.
Thank you, Honorable Ndongeni. Minister.
Well, thank you very much, Honorable Member, Honorable Ndongeni, and the Chair. Chair, clearly, I've already indicated that we do have a very close interest in the speedy resolution of this matter. So from our various teams within the department and also outside the department, with our, our scientists, our medical specialists, we will coordinate additional information which is available to assist in terms of providing any information which SAPRA may still be needing so that this matter can be speedily resolved. It is in our interest that be done. So our team will definitely, working also with civil society, we have a very active civil society movement within SANAC. So working with our civil society, our people living with HIV, business society, the business sector, and also from labor, all within SANAC. We mobilizing all the SANAC role players to make sure that we can add our voice in terms of motivation to SAPRA to make sure that this injectable solution can be speedily considered and hopefully be approved speedily. So we will definitely be adding our voice in assisting this approval. Thank you.
Thank you, Honorable Minister. The next follow-up will be by Honorable MEP De Bruin.
Thank you, Deputy Chair. Honorable Minister, in the short time of the COVID-19 pandemic in South Africa managed to produce COVID-19 vaccines locally, even though none have been sold so far to help the pandemic, to help in the pandemic. And on the other hand, South Africa has been battling HIV for decades now, and the country could still not manage to produce any HIV medication locally. So, Minister, once this treatment is approved, will South Africa's state laboratories therefore be able to produce these HIV injections locally? And if not, why not? And what efforts will the government take to obtain these HIV injections? From which suppliers and at what cost? Thank you.
Thank you, Honorable De Bruin. Honorable Minister.
Thank you very much, Honorable Chairperson and Honorable Member. Indeed, it's been a struggle. About 3 months ago, in the course of July, we attended the International AIDS Conference in Montreal, in Canada. And one of the major topics of discussion was why has it taken so long and we still don't have an HIV vaccine? When COVID was discovered early in 2020, and already, I mean, late 2019, December, but mainly when it was really started to be prevalent was early in 2020. But already by the end of the year, there was a vaccine for COVID. So there's a lot of optimism. The number of scientists were presenting there indicating that with the new technologies, especially your messenger RNA technology, which has led to the production of some of the COVID vaccines, with that new technology, there's optimism that even an HIV vaccine can be produced. Now, in terms of whether we will be able to have this kind of injectables, produced here in South Africa, that's going to depend on a number of factors. As members would know, there is also intellectual property protection laws for which the manufacturers and those who have been able to produce these medications are protected to some extent in terms of those laws. But our quite well advanced medical scientists in South Africa and various manufacturers definitely using readily available information on how these medications were produced, just like it has happened with COVID-19 vaccines. We never know. We will encourage them to look at the possibility of local production. But at this stage, it's not something which we are quite certain. So our priority at this stage, get approval so that and negotiate the prices so that we can make sure that this very essential preventative injection can be made available to our citizens. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. The last follow-up on this question is by Honorable Mr. Kenny Mutsamai. Honorable Mutsamai is also on the virtual platform.
Thank you, Deputy Chairperson. Thank Minister. Ke lenaneo lefe le le mo tirisong go netefatsa gore lemao le thibelo ya mogare wa HIV le tsenngwa tirisong mo Afrika Borwa? Re lebile gore ke batho ba ka nnang dimilione di le 8 ba ba tshwaeditsweng ke mogare o. Lenaneo lena le a go ja madi a makae, Minister? Ke a leboga.
Ke a leboga, Ntate. Honorable Minister.
Ke a leboga, Ntate Mutsamai. gona bjanong taba e re lebeletseng ke gore lemao le la go thibela bolwetse bja HIV le hwetsagale mo Afrika Borwa mo gore batho ba nang le kotsi ya gore ba ka tshwara ke bolwetse bja HIV go ya ka maemo a bona ba be le sebaka sa go ka hwetsa lemao le la go thibela bolwetse bja HIV. Bjanong se re swantse gore re se dire se le gore ya se dira gona bjanong ke gore batsweletsi ba lemao le ba tsentshitse kgopelo mo lekgotleng la SAPRA e le go lona le le laolang go ngwadiswa ga ditlhare le di-injection le ditshebediso tsa bophelo mo South Africa mo gore ba fiwe tshwanelo go ba license ya gore lemao le le tle le sebediswe mo South Africa mo. Ga re hweditse tumello eo ya go tswa ko SAPRA, then re tla kgona rena re le bakgoro ya maphelo gore re kgone go ka le reka go batsweletsi ba lona. Bjano o botsitse le ka gore price ya yona gore re tlo berekisa madi a makana-kanang. Ga e le gona bjanong ga re so ka bjale ka ke bolela gore price e santse e le godimonyana, re na le tshepo ya gore ga re go fitlha nako e le gore le tlabe le registerilwe le ngwadisitswe mo South Africa mo, re tla ba re setse re boletse le batsweletsi ba lemao le gore ba kgone go ka re rekisetsa lona ka price ya fasenyana gore re kgone go ka lefa batho ba mo South Africa mo. Ke a leboga.
Ke a leboga, Minister. The next question is question 140, as asked by Honorable Mr. M.E. Chabeleng, and it's over to you, Honorable Minister.
Thank you very much, Honorable Chairperson. Honorable Chabeleng wanted to know whether our grants which are being used to fight the pandemic of HIV, the epidemic tuberculosis, malaria, and also whether our community outreach programs are actually achieving the goals which we have set for. Now, in reply to that, honorable members, the financing by our government in response to these various infections, HIV, TB, and malaria, through the conditional grants, has translated into South Africa being amongst the few middle and low income countries, especially in sub-Saharan Africa, who are contributing. We are one of the few countries contributing immensely from our own financial resources to the fight against HIV, TB, and also malaria. Now, as you would know, that we have a very high prevalence of HIV, and our antiretroviral rollout program is the biggest in the world. We currently have just over 5.35 million people on treatment. And this is a significant number in terms of the total number of projected people who we believe in terms of our projections are HIV positive. We know that we have on average close to 7 million people in terms of the projection. So we still need to find close to another 1.5 million people to can benefit from this program. But it is already a very big program, and we have retained majority of people. We did have some slip up during the high levels of COVID and lockdowns, but we have already, our catch-up plans have already brought back a lot of the people back on treatment. It has seen our improvement in the life expectancy. In the early 2000s, around 2005, 2006, our life expectancy were in the 50s, around 52%. As we speak now, the average life expectancy is around 64%. So there's a major improvement in this regard. Similarly, with the TB as well, we have made a lot of progress in terms of rollout of TB treatment. There's still a lot which we need to do to test more people in terms of our screening. make sure that more people are put on treatment, including also preventative therapy for those at high risk in terms of TB. Now, in terms of malaria as well, through these grants, we're doing a lot of work in terms of prevention of malaria. A lot of progress has been made at some stage in around the 2013-2014 period. We're having up to about 9,000 per year cases of malaria. In the immediate past financial year, 2020-21, this was almost half, just over 5,000 cases of malaria. Similarly, in terms of mortality, it's also been highly reduced. In terms of the outreach, community outreach, this program has made it possible for all provinces to hire community health workers, different numbers per province, and these are all receiving a stipend, which is in terms of the labor relations, and they are being retained, and there are various discussions in terms of long-term retention. Currently is on a 3-year contract. So this is all operating well, and a lot of lives are being saved, and many people are able to get services through this program. Thank you very much, Honorable Chairperson.
Thank you, Honorable Minister. Honorable Ntshabeleng, any follow-up?
Thanks, Deputy Chair, and a big thank you to the Minister for the elaborate answers to my question. Almost it is very clear that the program is really achieving its intended objectives, its main objectives. It is also very encouraging to hear about the sizable drop in the number of malaria cases. I just want to know, what is the effect of the program on the number of deaths caused by malaria? Is there a reduction or? Thank you very much.
Thank you, Honorable Ntshabeleng. Honorable Minister.
Indeed, thank you very much, Honorable Member. Indeed, in all the diseases which I've mentioned, starting with HIV, I've already indicated the kind of impact which this program has had in terms of life expectancy, which means that the number of people succumbing from HIV has dramatically dropped. Similarly, in as far as tuberculosis is concerned, and also in the area of malaria, we have seen an almost 55% decline, both in terms of malaria infections, but also in terms of mortality from malaria. So these programs are indeed having major impact in terms of saving lives of South Africans. Thank you very much, Honorable Chairperson.
Thank you, Honorable Minister. Honorable Hadebe.
Thank you. Thank you, Honorable Deputy Chairperson, Honorable Minister. In line with the condition of TB, malaria, community outreach program, HIV and AIDS component, the responsibility of national government is to visit provinces twice a year to monitor implementation and provide support, as well as to meet with the National Treasury to review grant performance on a quarterly basis. Whether the national government has met the condition of these visits to the provinces, and whether the department has met with National Treasury as stipulated in the condition of the grant. If not, why not? If so, please provide details. Thank you.
Honorable Minister.
Well, thank you very much, Honorable Member, Honorable Chairperson. Indeed, as you would be aware that this is operated under the Division of Revenue Act with very specified conditions. So within our finance department, the National Department of Health, and also in the line function branch, which is the HIV, TB, and malaria branch, we have very strict follow-ups. So not only does the program managers, visit provinces to make sure that these programs are performing and that they receive reports according to the business plan, but also from our own finance department, our provincial support from finance also is part of these visits. And in many of them, when they do that, they also are accompanied by their colleagues from the National Treasury. And that is why when you look at our reports annually, even in the last financial year, you will find that these programs will be performing at the expenditure of nothing less than 98 to 99%. In a number of cases, actually, at 100% expenditure, because they are very clearly monitored, and the provinces also know that if you don't comply with the requirements in terms of the Division of Revenue Act, you run the risk of your funds being diverted to other provinces. So that's far, we have not had any query, whether from the Treasury or from the AG in terms of the performance of these programs. So I can assure the honorable members that indeed what has been stipulated as the requirements are being followed very strictly. Thank you very much.
Thank you, Honorable Minister. The next follow-up will be by Honorable Matibula.
Thank you very much, Deputy Chair. Minister, South Africa previous occasion missed the case for which recent measures of intervention have been put in place to eliminate malaria, as I have not seen an active outreach program nor spraying of malaria around communities in Mopane, in Limpopo this year. Thank you.
Thank you, Honorable Matibula. Minister, I'm sure you got the question, or it seems to me more of a remark.
Well, there is a question, Honorable Chair, about whether we are indeed doing the prevention of malaria. Indeed, I can assure the Honorable Member and Honorable House that we very diligently do that. And as we do that, we, in terms of, so on the one hand, is detection of malaria, so that our clinicians on the ground, including at primary health, they know what are the symptoms. And if there's a suspicion that somebody may have malaria, they would immediately test, and so that if it's positive, the person can be treated. But also in terms of the prevention side, there is the indoor residual spraying of mosquitoes is still ongoing. In terms of this, as we would be aware, there are 3 endemic provinces. That's Limpopo in the Vembe and Mopane districts, and then Mpumalanga in a number of districts in Mpumalanga, Bushbuck Ridge, Nkomazi, those areas, and in KwaZulu-Natal, in the northern part of KwaZulu-Natal, bordering on Mozambique and Eswatini. So all those areas, we have our teams which plan working, but also beyond our borders, we also work with the neighboring countries. So I can assure the honorable member that during the course of next month, we will actually be embarking. So the teams are busy preparing, acquiring the materials. During November, they will be doing the spraying. So they will be seen in the Mopane district. Thank you very much.
Thank you, Honorable Minister. Limpopo mense klap net vir Limpopo aan. Ken then now, Honorable Baga.
Yeah, and it's a solo clap because it's clapping alone. Thank you, Deputy Chair. Minister, civil society groups are the key role players in bringing health services to the communities. What is the working relationship with civil society? And what are the key indicators to measure and monitor that those objectives are met and successfully so? Thank you, Minister.
Thank you, Honorable Baha. Minister.
Thank you very much, Honorable Chair, Honorable Member. Indeed, this epidemics and pandemics, you can't defeat them without working with society. So, and South African National AIDS Council was created specifically to make sure that there's all this sort of a tripartite alliance within there. We've got civil society, you've got labor, you've got also, now we also launched a private sector forum, which is also part of SANAC. So all the partners, government is held accountable in terms of delivering on the interventions which require government. As you would know, that SANAC is chaired by the Deputy President, but we also have a co-chair from the civil society. So there are programs in terms of HIV prevention. We've got the National Strategic Plan, which is now working for the National Strategic Plan, which is adopted by a SANAC plenary meeting. Currently, the plan which we are utilizing was supposed to end this year, but we have agreed that it will end in March 2023 because of the time the time we lost during the lockdowns. So that is the compact through which we work with civil society. And in the National Strategic Plan, there are particular targets in terms of dealing with sexually transmitted infections, reducing them. There's the targets which are being measured in terms of the 1990, in terms of HIV control, which is also international, not just local. We are now chasing the 95 by 2025. TB as well, there are particular targets. So we do have particular targets with which we are working with the civil society in a very organized way through plenary meetings of SANAC through which we give reports. Thank you very much, Honorable Chair.
Thank you very much, Honorable Minister. The next question is question 134, as asked by Honorable MAP De Bruin. And Minister, it's over to you.
Thank you very much, Honorable Chairperson. I'm trying to just make sure that I've got the right one. Honorable De Bruin wanted to know about the staff shortages that are plaguing most of health facilities in the Free State and which are contributing to a poor state of healthcare. Now, in terms of the state of affairs in the Free State, we have communicated with our colleagues in the province, and they have given us an update in terms of where the situation is in as far as the staffing of our health facilities in the Free State. There are currently just over 6,000 vacant posts all across various health facilities in the province. Now, these posts are mainly remain unfilled because of the shortage of funds. Institutions are required to prioritize so that the key priority posts can always be filled whenever funds are available. As honorable members would know that with the reduction in revenue within the fiscus, with the poor performance of the economy, the cost of employment is one of the, I think almost 60% or more of the expenditure of government is on cost of employment, especially when the broader cake of the fiscus is not increasing. So all our provinces, all our facilities are under tremendous pressure in this regard in terms of filling the posts. So in terms of what then is being done, the province is taking steps to prioritize particular key, frontline service posts. And to do that, they've created a recruitment task team that is responsible to reprioritize critical posts and make sure that whenever funds are available, those posts can be filled. So at the current moment, 875 posts have been identified as key strategic, key priority posts, which needs to be filled over the next few months. And the hope is that come the next financial year, an amount of 200 million will be made available through the provincial treasury to be able to fill this key, essential post. I can also just add, honorable members, that we're working with all provinces, and we have made a case to the Minister of Finance and his team to really make sure that in the coming year, they must do everything possible not to effect any further budget cuts. That's the minimum which we have asked for, so that we don't suffer any further reduction in the staffing in the frontline services. So we're working with the Free State and all other provinces. I've given instruction to our DG and Chief Financial Officer to get together all the data of this number of posts, which are very critical. And this is a matter which I'm prioritizing also to support our colleagues in the provinces to try and see if we can get additional funding. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. Any follow-up, Honorable De Bruin?
Thank you, Deputy Chair. Honorable Minister, aside from the figures that you've just given us now for after more than 6,000 vacant posts in the Free State, you also answered a question previously asked by the Freedom Front Plus, where you stated that there are more than 10,831 vacant nursing positions in state hospitals across the country and 1,339 positions for doctors that is vacant in state hospitals. Minister, you have now just stated that more funds will be made available in the next financial year to try and compensate for this. And in light of this, will your department take a realistic approach to do away with race-based policies like affirmative action to help remedy the staff shortages at state hospitals and clinics, seeing as that there are thousands of trained professionals who are unemployed at this stage due to race-based policies? Thank you.
Honorable Minister.
Well, Honorable Member, as far as I'm aware, because of the scarcity of skills within the health sector, the issue of affirmative action, that's a policy of government, but also it's within our constitution to correct, the wrongs of the past. But in as far as directly in the health sector is concerned, that's not really a major issue, in the sense that even though there will be certain categories of health professions where Black people in general in the past may not have had opportunities, over time that has been reduced quite drastically, such that I doubt if you can give an example, and I don't want I know that I'm not allowed to have a dialogue with you, but I'll be very doubtful that you could provide to me a practical situation where healthcare professionals have been denied to be employed into our public health system on the basis of affirmative action. As I've said, that is a policy which is the correct policy, but I will contest to you that in terms of the health sector, just by the nature of the skills required, we basically look for particular skills. But of course, we want to also level the playing field, make sure that in terms of training, that Black people, the kind of skills which would have been denied Black people in the past should not happen again. But I can assure you that overall in the healthcare sector, we often take the skills which are available to provide the service which is required. So I wouldn't really agree with you that, as I've indicated, the biggest issue is just to make sure that the fiscus can provide us with the necessary resources so that we can take in as many healthcare professionals and other support staff as is possible. Thank you very much.
Thank you, Honorable Minister. The next follow-up will be by Honorable W.A.S. Outcome. Honorable Outcome.
Thank you, Honorable Deputy Chairperson. Honorable Minister, COVID is affecting the lives and livelihood of many people globally. A lot of people who were previously fit and healthy before they contracted COVID are now struggling with basic day-to-day tasks. Healthcare workers, not only in the Free State, but elsewhere in the country as well, have been at the forefront of the fight against COVID. And we witness them getting infected on a daily basis. In the long run, they might develop excessive fatigue and brain fog. They may not perform at their utmost at work. What support system is available for them to ensure that they deliver the best service in the light of being short-staffed? Thank you very much, Honourable Chair, Deputy Chairperson.
Thank you, Honourable Outcome. Honourable Minister.
Thank you very much, and thank you, Honourable Member. Indeed, you're spot on in terms of the impact of COVID, not only physically but also mentally. That it's our frontline health workers have really borne the brunt of the pandemic. So COVID has brought upfront more acutely the issue of employee support systems. So on a regular basis, we are making sure that the occupational health safety matters are very strongly attended to. We do have from the department one of our chief directors who is helping us, even though it's not his primary appointment, but amongst other responsibilities, looking after the occupational health safety to make sure that some of the things which may have been neglected in the past, to make sure that at the level of service that the health workers, the conditions of service, the ventilation, the hours of work, and all that is taken care of. That there's support systems, psychological support, also in terms of social workers, and also creating the necessary environment and training also supervisors and managers to be able to detect where some of our healthcare workers may be suffering under whether physical fatigue or mental fatigue. And we are also making sure that in all our provinces, especially the mental health support and recognition of support systems for our healthcare workers in terms of mental health and wellness. That should also be taken care of. There's still a lot which needs to be done, but indeed COVID has brought the key element of looking after our workforce very much to the front, and we're making sure that through our OHS system we can be able to look after them. Thank you very much.
Thank you, Honourable Minister. The next will be Honourable MS Muletsane.
Thank you, Deputy Chairperson. Minister, is your department able to attract relevant qualified people to fill vacancies, especially in Free State provincial hospitals? If yes, why are we still experiencing poor services in hospitals such as PLENARY and Bongani hospitals, to mention the few? Thank you, Deputy Chair.
Thank you, Honourable Muletsane. Minister.
Well, thank you very much, Honourable Chairperson. Yes, indeed, we are able to attract qualified professionals. Of course, one will not deny that if you talk of a hospital like Bongani, those which are in small towns and semi-rural or rural areas, you don't easily attract certain high caliber, experienced and qualified staff into some of our outlying hospitals. But at this stage, the major stumbling block is the necessary funding. There are quite a number of qualified professionals who are available to can be employed. We do have some shortage in as far as, for instance, in the nursing field. Some of the specialized specialty skills in nursing, like your ICU nurses, your theater nurses, your advanced midwives. We do struggle sometimes in terms of some of those skills, but we do have other ways to attract such skills. For instance, in terms of allowances such as a rural allowance, and those which try to attract, high-skilled health workers into even remote rural areas. But if we could just be able to address the fiscal issues, the financial, the immediate pressure is that of just being able to fund approved existing posts. If we can just be able to move that step, the issue of then we can deal with where there might be challenges in terms of people, highly qualified professionals, not maybe willing to go to some of our facilities. But that's not the immediate challenge. Thank you very much, Chair.
Thank you, Honorable Minister. Honorable Ntube, you will be the one for the final question, and he's also on the virtual platform.
Thanks, Deputy Chairperson of the Council. Minister, you have mentioned that overall there are about more than 6,000 vacant posts in the Free State. However, you have mentioned that about 875 vacant posts are the most critical ones in the department. So would like you, Minister, to at least elaborate more. How will the filling of 875 vacant posts improve the healthcare in the Free State? Thank you very much, Honorable Deputy Chairperson of the Council.
Thank you, Honorable Ntube. Minister.
Thank you very much, Honorable Member. Indeed, health service, it's a very high labor intensive or human resource intensive. You can have your machines, you can have your medicines, you can have everything, but if you don't have the people on the ground, then you're not able to provide, high quality service. So accepting the fact that we're in a very depressed economic situation. It was first over the last two and a half years, COVID, and now with the conflict in Russia, Ukraine, all sorts of things are now happening, which are also retarding our economic growth and ability to have more revenue. So because of that, we have worked with our provinces, including the Free State, to just identify. So when they say 875 high priority, it means these are really at the frontline services in your casualties, in your maternity wards, in your theaters, in all these areas which are very key for life saving, where you require people with a particular skills. So I'm optimistic that if our plea to our colleagues, the Minister of Finance and his team, if they can be positive and we don't have serious or we don't have any further budget cuts and hopefully have some improvement, we will be able to work with provinces like the Free State. And the situation in the Free State is not different from others in the country. And if we are to be able to do that in the next 5 months, when unless if the minister may able even pull out some magic through the medium-term budget policy, give us some other additional, if not at least in the next financial year, if we get something, we will share with the provinces and make sure that at least for starters, no budget cuts. And if something comes forward, we will definitely help to prioritize with the Free State. And this will make a huge impact in terms of improvement of saving lives and quality of service. Thank you very much, Honorable Chair.
Thank you very much, Honorable Minister. The next question is 155, as asked by the Honorable Mbaha, and we will now request Minister to respond.
Thank you very much, Honorable Chair. The question is dealing with, again, the impact of load shedding, as almost similar to the first question I dealt with, but specifically on impact on equipment. It is indeed true that load shedding does not only have an impact in terms of delaying and frustrating the certain procedures in hospitals and risking in terms of quality of service, but it is also a risk in terms of many of our equipment, whether it be in the laboratories, where certain tests have to be done. Those machines, are very sensitive to power supply. So if there's any interruption, you can end up, having to recalibrate some of those machines, and some of them can even be damaged. Similarly, a number of other diagnostic equipments, whether it be ultrasound, X-rays, CT scanners, many of those are very sensitive to stable electricity supply. And we have received reports from a number of provinces where some of the institutions where equipment which would have lasted for 10 years end up, just after about 5-6 years, not being able to be functional because of the irregular supply of electricity. So as a result of this, that's why we are indeed, as I've indicated, prioritizing stable supply of electricity to make sure that operations of the hospitals, all sorts of work in the hospitals and clinics are not interrupted, but also making sure that this life-saving equipment can be sustained and also last longer, run through their full lifespan rather than a shortened lifespan. So we're monitoring this, working with our hospitals, and we are expecting that by the end of this quarter, this third quarter of the financial year, a lot more health facilities will have benefited from what I reported earlier on in terms of exemption from load shedding. So we're putting really a lot of energy in this, and also supporting our province in as far as other emergency measures, including making sure that our standby generators are also always well serviced and ready to kick in when the power supply does get cut off. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. Before Honorable Baha, members, we will not have tea. We will not break for tea. So if you are really, really thirsty, there is tea outside. So, but one at a time. Honorable Baha, first follow up.
Thank you, Deputy Chair, and thank you for the offer for tea. Minister, I got your response, but load shedding has been and continues to be a thorn in people's lives. How many patients on life support have lost their lives due to load shedding? And how is the department taking responsibility for that? Why can't hospitals receive the same priority as ministers and be exempted from load shedding? Thank you.
Honorable Minister.
Well, I would be very happy if Honorable Baha can include me amongst the ministers who are protected.
I really wish.
As I'm talking to you now, my load shedding has just been lifted just before we started this session. So I don't know. I would request an honorable member to give me the contact number of the person who secures ministers from load shedding. But in as far as lives lost, fortunately, up to now, honorable members, we don't have reports of specific lives lost which can be attributed directly to load shedding. As I've indicated that any hospital which, amongst other things, would have a 24-hour service, as all hospitals do have, and also even more, those who have facilities such as intensive care unit, theaters, and high care divisions, trauma units, and all those. Any institution which operates those kind of facilities, the managers, the clinicians know very well that they have to prioritize your ICUs, your high care, where patients are on oxygen, life support. Those are non-negotiable. So at this stage, honorable members, we have not received any report indicating that there are South Africans who have lost their lives in this division, in these areas of care. But that does not mean that load shedding doesn't have a devastating impact, because it does reduce the services. Hospitals have to prioritize some of the services, laundry, other areas, machinery, sterilization of equipment, which may need a lot of power. And so certain procedures will be rescheduled if there is continuous load shedding, because the emergency power supply will not be able to carry all the services. So by saying that we've not had reports of actual lives lost, it doesn't mean that we're undermining the impact. The impact is huge, but because of the fact that we make contingency plans, and as I've said, we do have a team which routinely visits hospitals, and generators are number one in terms of assessing. I mean, there was some time ago a particular hospital where a generator couldn't kick in, and only to find that the manager responsible did not fill up the diesel. And that was taken as a very serious offense, and that person had to be taken for discipline, because that can cost lives. So we do that on a routine basis. Thank you very much, honorable members.
Thank you, Honorable Minister. The next follow-up will be asked by Honorable Mutsamai. Honorable Mutsamai.
Thank you, Chairperson, Deputy Chairperson. Ke a leboga Minister. Maokela a hloka motlakase ka dinako tsotlhe. Ntle le go kgaoga ga neelo balwetsi tlhokomelo ka dinako tsotlhe, didiriswa tse kwa maokelong ga di a direlwa go semagana le kgaogo ya motlakase. Ka seo e ka nna kotsi thata go balwetsi. Ke kgato efe e tsere maokelo potlana segolo bogolo jang a kwa metse magae le metse setoropong a gantsi a ikgatolositsweng ke lefapha la gago? Ke a leboga Minister.
Ke a leboga Ntate. Honorable Minister.
Ke a leboga Ntate Mutsamai. Ke nnete gore didiriswa tse dintsi tsa mo maokelong ga di kgone go ka sebetsa go sena motlakase. Bealo ebile di ka senyega ge motlakase o ntse o ya tlase le godimo o kgaoga. Ditirelo tsa go tshwana le bo di-X-ray, bo di-ultrasound le metšhini e meng ya ko di-laboratorying, le metšhini ya go sebediswa ko di-theater mo operatiwang teng e ka senyega ge nako motlakase o ntse o kgaoga. Beano ka lebaka leo re le kgoro ya bophelo ya naga re bereka le basebetsi ka rona mako di-provinceng gore gagolo-golo ona maokelo a leng ko magaeng le a leng ko makeišeneng ko ditoropong a tlhokomelwe gagolo gore a hwetse motlakase, a be le tsona di-generator tse e leng gore ga motlakase o tima wa Eskom e be gore di-generator tseo di a bereka. Re na le basumi ba rona ba e le gore nako le nako ba ya ba checka di-generator tseo gore di a sebetsa, and ebile ba bona e le gore bao ba swantse gore ba di orderele makhure a bona bo di-diesel ba bereka gantle gore diesel tseo di nna di le gona. Bara godimo ga moo ke boletse gore re busy re berekana le Eskom gore le ba masepala ba ba supply motlakase mo dipetleleng gore ba re fe dithapo tse tlhokaneng le tse di yang mo metseng tse di tla go ya straight ko maokelong tse e leng gore ge go na le load shedding ya go tima motlakase maokelo a rona a be a bolokege a se ka timela motlakase. Ke a leboga.
Minister. Honorable Radebe.
Thank you, Honorable Deputy Chairperson. Honorable Minister, it is reported that most hospitals have already exhausted their budget for generator fuel. As a result, they are forced to shift the budget from other line items, mainly support service items. Whether the minister is able to provide details as to how the quality of service patients receive is impacted by a lack of support service items, and whether hospitals are provided with alternatives. Thank you, Honorable Minister.
Thank you, Honorable Minister. Over to you.
Thank you very much, Honorable Member. Indeed, in our provincial support services, it has come to our attention that a number of institutions, a number of hospitals, in terms of their budgets, and also going back to provinces, that their diesel, because mainly the fuel used is largely diesel and not petrol, that their funds for those fuels are running short. So we have agreed that we should work individually with each province, look at what reprioritization is possible within their own budgets, and where possible, if from the national side we're able to identify any particular savings through which we can be able to support the provinces. In the event where this is not possible, we have also raised the matter with our colleagues at National Treasury that in the event that this becomes an emergency of unavoidable and there's a term which is used, unforeseen and unavoidable. At this stage, we have not yet submitted the unforeseen, unavoidable to Treasury, because our team has indicated that without compromising services, they think they will be able to identify some areas of savings within the budget, which will not compromise services. So that's what we are doing at this stage. But we also, watching that space, because we're hoping that the level of load shedding will start going down. But since we can see that we're still on level 3, 4 on a daily basis, it does mean that this matter in the remaining 5 months of the current financial year, it may come back to us. So our team of provincial support, including our finance side and also on the service side, are working, and our hospital services are working with all our colleagues to monitor this situation, so that we must never reach a situation where a particular hospital cannot provide fuel and therefore cannot sustain the generator. So that's what we are doing, honorable members. Thank you.
Thank you, Honorable Minister. Honorable Gillian, you will be asking the next follow-up question.
Thank you, Deputy Chairperson. Thank you, Honorable Minister, for your response to the question. Does the department have a program that constantly monitors the conditions of generators in the different hospitals? Thank you, Deputy Chair.
Thank you, Honorable Gillian. Honorable Minister.
Yes, Honorable Member, indeed, we do have such a program. I think I touched on it in my earlier comments, but just to be going to a little bit more detail, we do have in the National Department, we have a number of areas through which we interface. One, at the finance side, we do have a chief directorate called Provincial Support, which works with all provinces. The team there visits provinces, and there are areas of service which is called non-negotiable, as I alluded earlier on, which they monitor. They get reports on a monthly basis. They monitor also from the expenditure and also the levels of all the essentials on the medicines, consumables. They monitor that. But key to that also of those non-negotiables is the issue of the generators, their condition, whether they are being serviced, whether the fuel is adequate to make sure that they remain operational. On the other side, we also, from the clinical services side, we have the hospital section, for which we just recently appointed a new DTG, who's got a team also, which works specifically with all the just under 400 hospitals from the district up to the central hospitals, and check regularly the various key aspects of functionality. But over and above that, at the top management level, each one of our senior managers at DTG and chief director level are also allocated a province. So there are various entry points at which we interface and work with our colleagues in provinces, and so that we can pick up. We're not always going to do that, but we try by all means, we pick up whenever there is a risk which needs to be attended. And at this stage of real regular power interruption, stability of our standby generators is a very key indicator of that performance. Thank you very much, Honorable Chair.
Thank you, Honorable Minister. The final question is question number 141 from Honorable Ntube, and it's over to you, Minister, for response.
Thank you very much, Honorable Chair. The question is dealing with the Nelson Mandela Fidel Castro program. The question is as to whether this program has actually been able to perform and to deliver at the required level in terms of improving the quality of service for South Africans. Indeed, honorable members, I can say without any doubt that the Nelson Mandela Fidel Castro program has had a major impact in as far as the quality of services at our hospitals. Firstly, just in terms of increasing the number of doctors available in our health facilities. The Nelson Mandela Fidel Castro program, since its inception in 1997, has been able to produce just a little under 2,700 new medical doctors just from this program. So it is just under 2,700. And many of these young people who graduated are from poor families. So these are young people from families which, if it wasn't for this program, would not have been able to go to university, not to even mention going to a medical school. They are also from rural and township areas, and when they complete, they generally go back to the provinces where they've been funded, and mostly if they have health facilities, once they've completed their internship, they've completed their community service, they go back to those communities where they come from. So they make a very direct impact. Over and above that, the training which they received in Cuba it's really unparalleled in as far as primary healthcare is concerned. So they make a lot of impact in terms of prevention of disease. They understand, promotion of health at community level, at family level. So they are not trained like many of us who trained here at home. When you are trained from day one in a hospital. These ones are trained even at community level and at family level to understand the pattern of illness and the wellness inside the family. So through this deployment of this cohort of graduates, just a few months ago, I oversaw and presided over the formal graduation ceremony of just over 1,100 graduates. This was a cumulative of over the last 2 years because of COVID, and all of them, they're out there in the rural areas, in the townships, in our most needy, health facilities. So indeed, this program, has made a lot of impact in improving the quality of care. Thank you very much, Honorable Chair and Honorable Ntube. Thank you.
Thank you, Honorable Minister. Any follow-up question, Honorable Ntube?
Thanks, Deputy Chairperson, and thanks, Minister, for your response. I just want to check if there are any graduates from this program that are currently unemployed. And if yes, Minister, what is the department doing to assist with their placement in the field? Thank you very much.
Thank you, Honorable Ntube. Honorable Minister.
Honorable Chair and Honorable Ntube and members, at this stage, I'm not informed of any. I've checked the graduates from this program. I think the only area which I haven't got the feedback is whether amongst, there was a few doctors let me say, in terms of internship, there is nobody who hasn't been placed. In terms of community service, there is no one who has not been placed. So the challenge might be amongst those who've completed their internship, who have completed their community service, who are now fully registered, where it might be possible that amongst the few areas, province like the Eastern Cape early this year had difficulty in absorbing some of their bursary holders. That's a matter which I would need to just check, but it has not come to the front in that respect. But because provinces have really funded, they've identified when they were recruited, they've paid for their training. I think 99.9% of the situation will be that all those graduates will be working in the priority areas identified by their provinces. Thank you very much.
Thank you, Honorable Minister. The next follow-up is from Honorable Ms. B.T. Matibula.
Deputy Chair, it will be myself.
It's fine.
Thank you, Deputy Chair.
Honorable Moletsane.
Minister, since the inception of this agreement of Nelson Mandela Fidel Castro medical collaboration, how many doctors have been produced and are currently working in the Free State Department of Health? Thank you.
Thank you, Honorable Moletsane. Minister.
My apology to the honorable member in terms of specific for Free State. With your permission, Honorable Chair, we could make the number available, but countrywide, as I've mentioned, it's just under 2,700. Could be quite specific, 2,617 of those who've qualified, fully qualified, some of whom are still in the either in internship, in their 2-year internship, or in their community service. The 1,100 I've mentioned earlier on are still in their 2-year internship program, and some of them are in their community service programs. But specifically in terms of the Free State, Honorable Chair, we will be able to get the number and make it available to the honorable member through your office, Honorable Chairperson. Thank you.
Thank you, Honorable Minister. The next follow-up is Honorable Mr. M.A.P. de Bruin.
Deputy Chair. Honorable Minister, regarding the 594 students and the ones that you mentioned now that recently graduated from the Cuban universities as part of the Nelson Mandela Fidel Castro medical collaboration program. Minister, since these students have to be integrated into the South African medical schools for quality assurance of the qualifications after the return, wouldn't you agree that with the 350 million rand that the government is donating to Cuba, we could have trained more accredited doctors in South Africa while supporting our own universities and medical schools with the same 350 million rand? So basically, Minister, why are we investing in Cuba to train our doctors when we have more than 10 medical schools in South Africa that can provide better qualified doctors for less than we are spending towards Cuba at this stage? Thank you.
Honorable Minister.
Well, let me just firstly correct the honorable member that the 18 months which is spent in South Africa is not a quality assurance. These graduates still do their final exam and get their degree from the Cuban medical schools. For your information, they do 5 years in Cuba, which is the same as the program here in South Africa in terms of 5 years of academic training. And then the final year in the medical schools here, you would have completed your academic training, then you're still an undergraduate, but you do more practical. Even during my time, which is many months ago, we did exactly that. In the final year, you do your practical training. which you're still going to be examined. That examination is largely clinical. I'm told currently it's been amended where there's also a little bit of written papers, but during my time, the final 6th year was more of just practical clinical assessment. So it's the same kind of the way it's been structured. Even in Cuba, they do the same. There's almost a similar curriculum. The only additional 6 months over and above the 12 months, which is normal after the 5 years, even in our medical schools, it's because of the language difference. There's an additional 6 months, so that because the universities in Cuba train in Spanish, this students, when they are still students by that time, we're given an additional 6 months so that it caters for the transition from medicine done in Spanish to medicine done in the practical work now, and the assessment, clinical assessment, which is done in English. So that's the only difference. So I just want to correct the honorable member. So, but there's a lot to gain from the Cuban training, far ahead of what we are doing here, as I've indicated. Very strong in primary healthcare, which is what we need. Strong in, they do their, even, you know, the community research right from first year. So you go into community when you are just doing your first year, and across until you complete, you know what is the prevention, what is health promotion, and all those. So if I know that your orthodox training of South Africans is basically to look at when you say somebody is highly trained, is if he can transplant a heart. We don't want, you know, we want to prevent a heart reaching the stage where it must be transplanted. If we can prevent it, the better, rather than spending millions and millions on just training people to take a heart from one person to another. So that's really, unfortunately, the standard which we are accustomed to in South Africa, instead of investing in the program which gives more value in training professionals who are going to prevent disease rather than just treat diseases. Thank you very much.
Thank you, Honorable Minister. Finally, we will call on Honorable the birthday girl for the final follow-up for today.
Thank you, Deputy Chairperson. Minister, my question is somewhat similar to Honorable De Bruyn's, but I want to elaborate a little bit. This program has been mired with faults since its inception, leaving students stranded in a foreign country without sufficient stipends, poor quality accommodation and food, and limited access to necessities such as toiletries and sanitary pads. Recently, an Eastern Cape medical student studying in Cuba has pleaded with authorities to allow him to finish his degree after being kicked out of medical school for holding 2 females hostage in his room. Training students in Cuba costs double what it would in South Africa. In fact, Minister, the South African Medical Association, SAMA, has pleaded with the South African government to stop sending students to Cuba and train them in South Africa. Furthermore, the provincial treasury is currently doing a forensic audit on suspected corruption in this program that had a budget of 313 million this year. So, Minister, I don't think you answered Honorable De Bruyn adequately. Are there plans to increase the number of medical students being trained in South Africa? Furthermore, Minister, I'm concerned that you have mentioned that the university training in Cuba is of a higher standard than is available in South Africa. So isn't it time that you put more effort into the quality of training in South Africa? And if, Minister, there are plans to increase the number of medical students being trained in South Africa, what are those relevant details, timelines, and expected numbers to be trained in the country in the future? Thank you.
Thank you, Honorable Christians, Honorable Minister.
Thank you very much to Honorable Member. Indeed, right from the beginning, when part of the motivation when a bigger number of students were sent to Cuba was because our local medical schools were reluctant to increase their intake. I can I can report to the Honorable House now that because of that competition, because of the fact that our local medical schools could see that they're going to lose out, they have ramped up their admissions. So medical schools which used to admit only 100, as we speak today, some of them admit double that. So as a result of that, the pressure on getting more number of students trained outside the country has reduced. So a lot more graduate students are being trained in South Africa. You would see, therefore, that so that question is already answered in the sense that because of, and even myself, when I was closely involved with this program, I used to meet with the medical deans. Even now, I still meet with the deans at least once a year, and the deputy minister also meets with the deans quite regularly, more than myself. And there's agreement that one, in terms of this increasing of uptake, is intake is already happening. In terms of the cost, the honourable member, when you add traveling costs, cost of tickets and other costs, and because of the foreign currency fluctuation, the cost does go up. But I can assure you that if you go and look at your costs, I mean, right there where we have our Houses of Parliament at the University of Cape Town, you will find that its total cost per student is not very different from the number which you have mentioned, the cost per student. If you just break down, including the cost of air ticket, because the students who go to Cuba don't fly back home every year. It's only after 2 years. It's actually 2 years in the course of the 5 years. After when they finish the second year of study, and then when they finish also the 4th year of study, and then after that they come back for good. So, but all those total costs, I can assure you, if you break down the full cost of a medical student at UCT, you will find that it's probably even higher than the cost of a student in Cuba. So we are indeed talking to the medical schools to improve their primary healthcare content of the curriculum. So because of we're saying better quality in Cuba because of the very strong primary healthcare. We're talking to the deans, and they are hard at work to make, and many of them have also gone to Cuba. And there's a year when, I think it was 2017, when I went with quite a number of deans to Cuba, and they interacted with their counterparts there to see how they could actually improve their primary healthcare content of their curriculum. Thank you very much.
Thank you very much, Honorable Minister. We have come to the end of the questions for yourself today. And we would like to really thank you for availing yourself to respond to the questions and also for your elaborate responses. We will now call on the House Chairperson firstly to take over the presiding of the House, but we will also call on the Honorable Minister of Social Development, who is going to be responding to questions. We once more want to welcome her in the House. And we will then give over to the Honorable Minister to respond to the question number 135, as asked by the Honorable Nkosi, whilst the House Chairperson is approaching. I don't know whether you want to take the podium. Yes, for sure, that is.
Thank you very much, House Chair. I was going to find it a bit difficult to be answering sitting, but I know this is a very long period in answering the questions, but I think I prefer being on this side. With regard to question 135, and thank you, House Chair. I do want to indicate, Chair, from the start, that it is not only due to the media reports that are referred to here by Honorable Nkosi. It is also because of SASSA's own institutional systems that we are able to discover in the process of processing the applicants, but also to realize that there are those in government who applied. And I do want to indicate, Honorable Chair, that in 2021, SASSA compared the PESAL database of government with the social grant payment system, the SOCPEN database, and identified 165,297 public servants who had received social grants. Following this, SASSA undertook a process to review all these grants as per the process outlined in the Social Assistance Act, because we are guided by the Social Assistance Act, with a view to ascertain the eligibility of identified beneficiaries. By 31st July, SASSA conducted 80,626 reviews. Remaining balance of 84,671 were suspended. And the question is, of course, why were they suspended if some of them do qualify? SASSA has also written to all directors general and heads of concerned departments requesting their assistance to finalize the review of the outstanding civil servants. This will include recovery of debts, appropriate disciplinary action where it is found that the identified civil servants have defrauded the system. Chair, I also want to indicate that as a Department of Social Development, we have zero tolerance to any type of fraud and corruption, and we continue to strengthen our institutions to make sure that we are not exposed to that. And also the fact that SASSA is to improve the agility of our system to detect and prevent fraud. SASSA has developed the application program interface, which is API, which is used to interface with database, including the population register of the Department of Home Affairs to confirm, identify, and life status, PESAL and Government Employee Pension Fund. These measures have strengthened SASSA's ability to validate information. SASSA has also implemented its interface to perform bank account verifications. And Chair, the social assistance legislation does not specifically refer to government officials. However, it does provide the qualifying criteria for various grants based on income identity. And so sometimes you might find that some government officials have applied because they do qualify basing on the fact of how much they earn, and some of them do qualify. And government officials may qualify for a particular grant if they meet the eligibility criteria. A simple example, Chair, would be that you might find somebody who is in the police force or in any other structure in government earning below what is acceptable and therefore would qualify. And some of these people, government officials, they also they adopt children, or they take care of children from either relatives or any other, and therefore they will qualify for the grant. For example, there are many instances where a government official is appointed by the court to foster a child, in which case the application may qualify for a foster child grant. SASSA thus applies the same assessment criteria to applicants, irrespective of whether or not they're employed in the public sector. But of course, as a matter of fact, those who take advantage of the system and apply when they know perfectly well that they're not supposed to apply, we take very strong exception to that, and we act in the best way that we can. But lastly, we're doing our best right now to strengthen our institutions and our systems, because technology is working very well for us now. So some of the thoughts we are all able to catch them that way. Thank you, Chair.
Thanks very much, Minister. The first person for supplement question is Honorable Inkosi Mpumalanga. Honorable
Thank you very
Inkosi.
much. Thank you very much, Honorable House Chair. Greetings to your good self, the Minister, and the members present in the House. Honorable Minister, thank you very much for your detailed response to my question. Honorable Minister, why did SASSA not prevented these payments to civil servants from the happening in the first place? Thank you, Honorable House Chair.
Thank you, Honorable Member, Honorable Minister.
Thank you very much, Honorable Inkosi, and thank you for that follow-up question. As I indicated in my response, is that we have to improve our system because our systems across government has to speak to each other in order for us to be able to get those, to catch those who apply when they are not supposed to apply. But also we are working together with all the relevant departments to make sure that the data that we refer to is data that speaks to each other. SASSA is in the process also, as I indicated much earlier on, is in the process of trying to get the best connectivity that can connect from the Department of Social Development itself and all other relevant departments where civil servants are working, so that when people apply, the system must be able to kick the person out who is applying and who does not qualify. The challenge we have at the moment is that the onus is still remains on the client to inform the agency if in case their circumstances change. So there are people whose circumstances are such that they qualify, but later on they do either get better jobs, and unfortunately they do not inform the agency. And that's why we are saying that the system that we need to develop, and considering the fact that technology is moving so fast and it is so good. And I think in the payment of the 350 grant, one of the things we've identified is that linkages in terms of data across the different government departments, and so that people don't necessarily have to, the onus must not remain in them, the system must be able to get them. The current set of public servants review are part of a progress of targeted reviews. Once these are completed, SASSA will be targeting other sectors for review. In fact, as soon as we catch that clients, our clients, we call them clients, but some of them are beneficiaries anyway, we give them enough time also, Honorable House Chair, if in case the system is not being fair to them or we are not being fair to them, those that qualify and have been removed in the system, they have 90 days notice to come back and indicate that they do qualify, as I indicated earlier on. And I think that 90 days is long enough for people to be able to, 90 days is long enough for us to be able to know whether they qualify or they don't qualify. Thank you.
Thanks very much, Minister. The second follow-up question is coming from DS, Honorable DS Christian from DA.
Thank you, House Chairperson. Minister, the SASSA agency has lost more than R500 million in the past 10 years due to people unduly benefiting from receiving social grants through either fraud or corruption. Amongst these were 761 officials. Cybercrime and SASSA card fraud seem to be the main culprits. And just recently, Minister, your ICT system was once again upgraded and applications came to a standstill. Is the current ICT system ineffective against cyber criminals? How did hundreds of SASSA cards land in criminals' hands over the last few years? And what is being done to prevent this from happening again? Thank you, House Chairperson.
Thanks, Honorable Member, Honorable Minister.
Thank you very much, Honorable Christian. As I indicated in answering the previous questions, it is very unfortunate that we live in a world where you fix your system, you think you've got the best system, and you've got crooks out there who are also running the same, trying to make the best of your system. And cybercrime is not only a problem for the Department of Social Development, but it's a worldwide and global challenge that is facing everyone. But obviously, it is our responsibility as the Department of Social Development and SASSA to consistently look for systems that are actually not too costly, because the unfortunate part is sometimes even when we find good systems, we find that they are just above our reach because they are too costly.
It is also unfortunate that you have people who out there whose sole intention is to look for fraud, for frauding, defrauding and the system. And some of them, unfortunately, they also have, sometimes it's an inside job because they've got people in the system who work with them. But one of the reasons why, for instance, we are doing our best to make sure that our system we even use in opening the computer, you don't just press, we have to make sure that you use your thumb and you use other mechanisms and other methods of ensuring that we lock the system. It's very costly, but it's something that we need to do because the amount of money that is lost is unacceptable to us and unacceptable to me as a Minister of Social Development. Yes, the ICT system, the department overall, as well as SASSA, presented their operational plans recently to ourselves, myself and the Deputy Minister. And one of the issues that we focused on was improving the systems in such a way that we reduce the losses that we have. And therefore the ICT system is a target system that we would like to upgrade as a department. And I was indicating to them that, by the way, the ICT system can be replaced even by our local, because in some instances I came to the department and found that some systems is a system that comes from India, some system comes from somewhere else, when South Africa itself is moving very fast in improving its own. And you've got young people here who are very smart, who are coming up and showing systems that can be very helpful to us. In short, it is unfortunate. It is a pity that we have to be losing so much money, but we are aware of the fact that we can be able to improve the system and make sure that we are able to lock it in. I've also requested SASSA that not only should we be looking at it from a departmental point of view or a SASSA point of view, we do have to get other departments that can be able to assist us, including intelligence, by the way, who can be able to assist us in ensuring that the cyber security policies themselves, they must help us, because to have a good policy but not have good systems in place doesn't help our situation. Thank you very much, Honorable Christian.
Thanks very much, Honorable Minister. The third follow-up question is coming from Honorable M. Dlamini, EFF.
Thank you, Chairperson. Due to connectivity, I would like to keep my camera off. To the Minister, have you detected whether the influence to manipulate the system of the department has an external, outside of the officials that are placed inside the department to ensure that the system is working? And then I would like to ask if the child-headed homes so if there is an instance where the beneficiary, the parents have passed away, is there a research done or a report that is in place to ensure that the funds go to where they're intended to go? Thank you.
Thanks so much, Honorable Member. Honorable Minister.
Yes, thank you very much, Chairperson. The good thing about SASSA is the fact that we have offices across the entire country, but we not only work on the basis of SASSA alone, but we also have the department, and under the department, you have a unit that deals with social welfare. One of the reasons why SASSA has got so much data, it is also because the government deliberately took a decision that says we must go out to the community to find the child-headed households, to find the indigent. We even have an indigent register in South Africa. And also the fact that we are now looking at the district-based, the district development model is for us to be able to catch or to be able to identify the most vulnerable within the community, so that the national, provincial, and local structures working together, but strengthening in particular the structures at local level, because at local level is where people live. As a minister, I can go to a particular province, but I would never be able to cover the entire province. Hence our strengthening the district development model. And in that district development model, our task as a Department of Social Development, and in particular for social welfare, we need to work with the local structure so that they can be the ones who identify what we are calling child-headed households. Our services are reaching those children in particular. And again, they are reaching them because we also have SASSA offices. In fact, I was very excited last weekend, if I may say, where I saw SASSA getting out of the office and having pamphlets and taking the pamphlets and distributing those pamphlets about the services of SASSA in KwaZulu-Natal. We have a new regional manager in KwaZulu-Natal, Mr. Mo Mzobe, who understood the importance of taking services to the people and therefore not waiting for people to come to the SASSA offices, but got everyone out of the office to go and show people the services of SASSA. And I saw them, they were at taxi ranks and all. I'm hoping that that kind of communication is something that can be done by all SASSA offices across the board, because part of what SASSA needs to do is to communicate to the people of its services. In fact, SASSA and the Department of Social Development has to make it easy for people to access the services that we are talking about. And Honorable Member, I want to also indicate that it is our view as a Department of Social Development that members of parliament have got constituencies. It is also through these constituencies that we have to be able to communicate. And if members know of child-headed households, or members know of children who are struggling and not being able to access, it is these members also have to use the constituency offices to communicate. And it will be the responsibility of SASSA to also reach out to these constituencies and leave the pamphlets by the constituencies. Lastly, we are also trying to use technology where people don't have to be going and traveling long distances to access the opportunities of SASSA. And again, we've learned from COVID-19 and the fact that the people who were applying for the 350, they did not have to go to any office to apply for that. We're looking at what else can we do to make sure that lessons learned from COVID-19 can be used to enable our people to easily access the services of SASSA. I thank you, Chair.
Thanks very much, Honorable Minister. The fourth follow-up question is going to ask by Mr. N.M. Khatebe, IFP, Honorable Bungan.
Thank you, Honorable House Chairperson, Honorable Minister. Honorable Minister, I would want to know what is the department doing to ensure that the money lost to the undeserving employees of the department is recovered, and that can we expect that the money recovered will be contributed to the overall budget to fund more of the expected beneficiaries? And lastly, what proactive and effective practices will the department be implementing to ensure better coordination within the department to avoid the awarding of grants to undeserving candidates? Thank you, Honorable Minister.
Thank you so much, Honorable Member. Honorable Minister.
Thank you very much, Honorable Khatebe. Yes, it is actually a nuisance that we now have to develop separate systems to make sure that money is protected. But beyond protecting the money, it is about catching people who, from the very beginning, they knew that they were not supposed to be applying. But I do want to make I do want to make the difference between those who are government officials who qualify, as I indicated in my previous answers, and those who deliberately defraud the state. We do have processes, and I think I said earlier on that we've written to the DGs of the departments where we have been able to identify those who applied knowing perfectly well they are not supposed to apply. And we are open, we're going to make sure that the departments open up cases against those but also disciplinary processes have to take place. The one thing that is we need to work on generally as government, and it's irrespective of who is in government. For me, it's about creating systems that are quick, systems that don't take too long. The challenge we have in South Africa is that to finally get to the point of catching people and finally saying you have to pay the money back. It's a long drawn process. And I've said to the department as well as I said, let's shorten those processes, because some cases are just clear cut, straightforward cases that do not need us to wait that long. The other challenge is also recovering that money. The process of recovering that money is also another long drawn process. And in some instances, I personally feel that we give people who have wronged the state even opportunities of say, are you able to pay it quickly, all of it, or do you want to extend it? My view is that if you took the money and you illegally took the money, you've got to pay it back exactly the way you took it. And therefore, our systems need to change, not only to respond to the needs of people, but also to respond to those people who are taking advantage and fraudulently getting money from the state. Yes, I do want to accept that I'm not happy with the due process. It just takes too long. And sometimes even these people who've done that, defrauded the state, they get away and they leave the government and they go somewhere else, and then it becomes very difficult for us to get the money back or to even get them. We need to strengthen our systems. The best thing for us to do is to strengthen our systems in such a way that even if you apply and you are not qualifying, you must not be able to get that money. Thank you, Chair.
Thank you so much, Minister. Minister, the next question now is 151 that have asked by Honorable Ms. DC Christian, Northern Cape, DA.
Thank you very much, Honorable Chair. And I must tell you that Honorable Christians keeps us very busy, not only for questions of oral reply, but even with questions for written replies. And I want the member to know, I write down all those questions because I want to make sure that I'm comfortable when they give me those questions. I must be comfortable that it's the answer that you deserve, because I appreciate very well and understand the fact that you are representing your constituency and your constituency wants those answers. To this particular question, yes, I have extended the appointment of Mr. Bongani Magongo as the Acting Chief Executive Officer, CEO of the National Development Agency in terms of Section 9(1) of the National Development Agency, Act number 108 of 1998 as amended. The appointment was extended with the effect from the 1st of October to the 31st of December or until the new board fills the vacancy. And honorable member, I do want to indicate to you that finally today I was able to present to cabinet, because I did present to cabinet. One of the reasons why it's taken this long, you might ask the question why it's taken this long. We advertised and people applied and we had to shortlist and all that. But cabinet was not happy with the provincial spread. And so I had to go back and make sure that there's a provincial spread, but also they were not happy with the youth because, again, the government of the African National Congress is also very serious about bringing young people into the fold as others retire. And so when they were not happy with that, I had to go back into the system. And I needed to make sure that I don't go out and look for people on the basis that I'm looking for just young people and the provincial spread. I needed to make sure that I follow due process, because I wasn't going to go out of the system and say, let me look for people who haven't applied. I had to go back to the system and look at the people who have applied and find the provincial spread and as well as look for young people. But unfortunately for us, with regard to young people below the ages of 35, we did not have ones who applied and were qualifying, because again, we need to make sure that this is a serious position of a CEO. You must make sure that you've got the right, the people have got the right qualification, but also even the experience and also the capacity to be able to perform in the job. That is what delayed us in terms of appointing the CEO, because I cannot appoint the CEO. I did not want either to appoint a CEO when I knew that the board was going to be coming in, and it's the responsibility of the board to appoint the CEO. What I made sure happens though, and I know that the board is going to be coming through, but it will not be able to immediately appoint the CEO. Fortunately, we've advertised. What I said to the department, let's not wait for the board to be in place before we advertise. Let's start the work for them so that by the time they come, we've done the advert, the shortlisting will be done by themselves, and the whole process of appointing a new CEO will be done by the board. Thank you very much.
Thanks very much, Honorable Member. Honorable Christian.
Thank you, House Chairperson. Minister, this agency's mandate is to eradicate poverty. Yet officials are approving irregular expenditure worth millions. The city press recently reported that they have seen invoices that were irregularly approved. As of 31st of July, 2022, there were 221 irregular expenditure cases outstanding to 512 million rand awaiting condemnation by National Treasury. There were 187 outstanding cases amounting to 448 million rand, where corrective action needed to be finalized. 29.47 million rand irregular expenditure in 2020-2021 financial year related to non-compliance. 38.18 million rand irregular expenditure in the 2019-2020 financial year, and in the 2018-2019 financial year, 18.1 million rand irregular expenditure. This also includes irregular leasing of offices. This money should have been used to eradicate poverty in a country where approximately 20 million people go to bed every night. Now, my question is, Minister, is it not time to review the National Development Agency's mandate and sustainability? And then, of course, for us to admit that the NDA is failing the poor in South Africa. Thank you, House Chairperson.
Thanks, Honorable Member. Honorable Minister.
Thank you very much, Chairperson. I think that in response to the specifications, I can give the Honorable Member the specific responses in terms of what is being done or what has been done, and clarify also the issues of irregular expenditure that we can submit in a written form, because I think it wouldn't be correct for me to be just guessing as I'm standing here. I can tell you, Honorable Member, I'll make sure that that information is written and sent to you. And of course, when it comes to the media, it is important that the media has the freedom of writing and expressing themselves or interviewing people and getting the information that they want. I wouldn't be able to speak for the city press because I don't know. We never hired any city press in our system. But if the city press has got people inside the system who prefer to give the city press than to fix the problem when they're sitting with it inside, I believe that when officials are in the system, they have recourse. One, their recourse of oversight to the NDA is the department itself. Secondly, their recourse is the executive, which is myself and the deputy minister. Plus, their recourse is the auditor and the internal audit as well as the external audit. And if they feel that there are certain things that they are not getting answers to, one would have appreciated that they raise those internally so that we can deal with them. However, it's a free country. It's a free world. If the city press has got better access than anybody else, they're free to do so. With regard to the mandate, I also would like Honorable House Chair to indicate to the Honorable Member that On arrival as a Minister of Social Development, I did indicate to the NDA that I personally thought the NDA had a greater responsibility, considering the fact that their role is that of empowering NPOs and NGOs on the ground. I felt that they could actually do a much better job than they were doing. And that's the reason why they went on a complete review. And again, honorable members, this review has been presented to the Portfolio Committee. And I think, honorable member, we can be able to also give you that review, because that review, I needed it to be done so that the National Development Agency could lift itself up from where it was and perform better than it had been performing. But also the NDA, unfortunately, its budget is very little. You can't have an NDA, National Development Agency, whose budget is less than 300 million. And yet at the same time, you are expecting it to be able to cover all the NPOs that they are supporting, especially those that are empowering women. I make an example of how I've seen the possibility of the NDA doing a greater job. Recently, we were in the Northern Cape with President Cyril Ramaphosa on the Izimbizo, and I met with the NDA regional manager, who actually told me that, Minister, a year ago you were here. You went to visit a cooperative that we had been supporting as NDA, and he was saying to me, since you told us that it's important for that cooperative to be supported by opening up markets, he said that cooperative is now standing on its own 2 feet. Those are the examples that one would see of the NDA doing across the country, and that Northern Cape one is a good example for me, and I'm hoping that they will also learn from it. If you go to KZN, also you find the same situation where you find some of the NPOs that have been supported by the NDA are doing very well, but they can't do that in isolation without support from other government departments. Thank you very much.
Thanks very much, Honorable Minister. The next follow-up question is coming from Honorable Nsube, ANC.
Thanks, Honorable Chair of the House. Honorable Minister, to a particular extent, you have indeed answered my question, but I just want to check in terms of the framework, when will the NDA board be appointed for us to deal with the appointment of the CEO? Thank you very much, Honorable House Chairperson.
Thank you, Honorable Member, Honorable Minister.
Yes, thank you very much. It was just a coincidence, really, that I got the chance to finally make this presentation. Obviously, the new board has to go through a process of integration, but it's also a process of training and a process of introducing them to the functions of the NDA. The good thing is that some of those members who are there have an experience of being in some other board, so we're not starting from scratch. And I'm hoping that once the board at least have been called to a meeting, they will be able to draw the timeframes as to when exactly they can appoint a new CEO. Thank you very much for that question.
Thank you very much, Honorable Minister. The next follow-up question is coming from Honorable F. Detroit, FF+.
Thank you, Honorable Chair. Honorable Minister, a report tabled by the NDA before the Parliamentary Portfolio Committee on Social Development on August 31st, 2022, showed that the agency had incurred irregular expenditure in the 2020-2021 financial year. Also, 29.5 million related to non-compliance with grant funding policy under the volunteer program. 39.2 billion related to non-compliance with supply chain management due to lack of competitive bidding processes, and 18.1 million relating to non-compliance with supply chain management legislation for the issuing of tenders and the request for quotes, mostly for office spaces, leases, and IT communication costs. Mr. Pogoga said the agency had accumulated a lot of irregular expenditure. of which more than 60% was because of deficiencies and a lack of appropriate capacities in the supply chain management function. In spite of this, he said, with reference to the reinstatement of the suspended senior executive, whom he reinstated after pursuing the documents, and I'm quoting, the reason that a disciplinary process is the only way to determine innocence or guilt is equivalent to the abuse of the system, especially if cost is part of the process. I believe that you're well aware of that appointment that did take place. My question, Minister, is in light of his statement, would you agree, A, that the acting CEO didn't didn't act in the best interest of the NDA, and that his relaxed position on disciplinary procedures would contribute to further financial losses and a culture of non-compliance? And B, would you agree that in the light of this, his appointment as acting CEO is to be questioned? Thank you, Minister.
Before the minister respond, I wanted to remind the members that a minister got 5 minutes and members got 2 minutes.
Thank you, Chair.
4. No.
Sorry, Chair, the minister's got 5 minutes for the first question
Yes.
and 4 minutes for the follow-up.
But here is, thanks very much, Honorable. But the watch here was saying 00, but you are correct in terms of 4 minutes. Thank you. You've got 5, Minister.
Thank you very much, Chairperson. I think the same as I said in my reply previously. I can guarantee you, standing on my 2 feet here, being able to just give the answers, particularly to specification of amounts, I cannot do that right now, but I can again be able to say we'll give you the full details in relation to specifications of exactly the amounts that we are talking about. Because we are very specific to reports that were presented to the portfolio committee. And I must apologize because sometimes you come here, you don't know what the follow-up questions are going to be. And unfortunately, you can't carry everything in your head and be able to answer. But I promise you, the specifications are going to be submitted to you. Now, with regard to the appointment, I did ask the CEO about specific disciplinary processes, and the CEO said to me he wasn't very sure which one is the specifications of the disciplinary processes, because again, when the questions are being asked about a specific case and I'm not aware of the specific case, I'm not exactly sure what the member is referring to. And again, even with that one, I will have to ask the CEO, but the CEO, the acting CEO, was appointed firstly on the basis of his capacity and on the basis of his experience being in the NDA. And we had hoped that his appointment was not going to be this long, because we had thought that the issue of the board and the advertisement and the application, and by the way, anyone who qualifies in the NDA, even himself, he might apply if he wants to apply, because he qualifies for that post. But again, I'm not exactly sure of the specific case that you are referring to. I'll go back and ask and give you the answer to that one. Thank you, Chair.
Thank you, Honorable Minister. The 4th follow-up question is going to ask by Honorable Mukause. Honorable Mukause.
Chair of the session, Honorable Mukause is not here. But already the minister has covered me with the question that I was going to pose. Thank you very much.
Thanks very much, Honorable Member. Honorable Minister, Siyakuba. Now, Siyagu, question 136. that have asked by Honorable Gillion, Western Cape, ANC.
Thank you very much, Honorable Chair, and I thank the Honorable Member Gillion for the question. Yes, the department is currently consulting with key stakeholders on the best possible options to render basic income grant support or basic income grant as it is referred to interchangeably. Once this process is completed, the draft policy will be tabled to Cabinet for consideration before the end of this current financial year. As members might be aware, the ANC had a policy conference recently, and resolutions from there affirmed this administration's commitment to the implementation of the comprehensive social security as envisaged in the National Development Plan. And Chairperson, here, for me, I'd like to also indicate that we would like members to look at the broader comprehensive social security that this government has been implementing since 1994, but also consider the ongoing challenges that our people face from an economy that is not doing as well as it is supposed to do, but also the global challenges that we face. And it is important to note, Honorable Chair members, that the debate on the introduction of basic income grant has been part of the national discourse for a very long time, dating back to days of Professor Taylor's committee report. And I do wish to thank Prof. Taylor, because she's really given it her best. Since that time, when the report came through, I was also able to pull her back again to the conversations about it, because what I didn't want to do is to take a policy position which has been developed by the very same African National Congress but never implemented for one reason or the other. I had to pull back the same people who had worked on the document, but of course with a few new who also have an experience in the basic income grant. I think what is very interesting here, Chair, is to indicate that when President Cyril Ramaphosa introduced the 350, my question to the department was, what do we do after the 350? Because COVID is still with us at the time. Remember, there was the first iteration, then there was a second iteration, and my concern was looking at the state of the people and the poverty and hunger and all. I was hoping that we can be able to extend the 350, which, by the way, was extended after a while. But I was saying to the department, we need to find something that is concrete, something that can be long-term. That's when the department then indicated to me that there was the Professor Taylor's committee report, and I requested that we bring that discussion back on board. That's why we have this discussion going on now. And we are of the view that income support is critical for sustainability of country's social fabric and future economic prospects. The fact that more than 10 million people between the ages of 18 and 59 years old of working age are without an income presents a significant risk to the economy's long-term performance, also even the stability in the country. We have taken the lead in expressing the dire need for more comprehensive response by government in the form of a basic income grant support, the unemployed between the ages 18 and 59. The implementation options we are proposing are mainly a progressive realization approach with small incremental changes over time, building on the success of the social release of disgrace grant. And we are aware, obviously, Chairperson, that there are detractors of the proposed basic income grant who tend to focus narrowly on the amount of money that government need to set aside to finalize the basic income grant and deliberately ignore the economic impact through which big will stimulate economic growth and generate additional revenue for government. The results of the implementation of COVID-19 SRD has demonstrated the positive impact of putting income in the hands of beneficiaries. The question that we need to ask all of us as South Africans, are we comfortable with the hunger?
Are we comfortable with the people who can't get jobs, even if they want to wake up in the morning and to get jobs? Are we comfortable even with the fact that some people cannot even have money to go even look for the jobs, let alone put food on the table? People who would want to wake up and go to the internet cafes and look and Google and find options for them. Are we comfortable with that? Do we think that's a bigger price or a lesser price, or is the bigger price the amount? Thank you. Thank you. Sorry, Chair. I get very excited about this one. My apology.
Thanks very much, Honorable Gillian.
Thank you, House Chairperson, and greetings to the Minister. Minister, thank you very much for your comprehensive response to my question. Honorable Minister, looking at the success of the SRD grant, the need for a more comprehensive response to support the unemployed is very clear. The question is, however, will a basic income grant be sustainable in the current economic context of our country?
Thanks, Honorable Member. Honorable Minister.
Thank you very much, Chairperson. I think partly I touched on the fact that South Africa needs to look at the deeper pain of those people who have absolutely nothing. Look deeper into the men and women who wake up in the morning with absolutely nothing, and then respond to that, how that can be able to be assisted is by ensuring that money is given to people for their basic needs. The latest research on the use of social relief of distress grant 350 shows that beneficiaries use it to purchase food and basic necessities, which generate revenue for the economy. We say they don't take the money and go and hide it somewhere or eat the money. They still have to go to the shop, go to the spaza, go somewhere to buy. So the money goes back into the economy. And the more you have people with some liquid in their hands, it means that the demand for those basic needs actually grow. In some instances, some beneficiaries started small businesses, which have since led them to no longer requiring the grant. Their access to income also enabled many to search for jobs and buy goods and services that they would otherwise not have purchased, this stimulating demand and increasing consumption in the economy. To the extent that they purchase goods that attract VAT, they also have contributed to the tax collection, which also contributes to economic growth. The question of sustainability is very important to the department. And it is for this reason, Chairperson, that we say people must not look at the Department of Social Development and think that we are just interested in only getting the 350 and distributing it. We want, as a department, to be part and parcel of the broader plan for economic development of our country. We want to be, and we are, part of the broader plan for ensuring that the economy grows so that people can go and get the jobs. Nobody wants to live on a 350. We live on the 350 because they don't have any other options. And therefore, our conversations that we have with Treasury and any other department that is relevant is not without us understanding and appreciating the economic challenges and the challenges of the fiscus, because the purse is not as large as we would want it to be. But we are saying if we are able to lift these people up, we can be able to look for some of the resources within government, including the fact that we need to look around even in some instances where there's wastage, and we must avoid and get rid of that wastage so that the money can be able to go into the hands of our people. Again, I go back to the same which I said earlier on. Is it about affordability, which I respect very much, and I must not be misunderstood to be blind to the economy, to be blind to the macroeconomic policies, to be blind to the implementation. I'm not blind to that, but I'm saying this country has a capacity and capability of feeding its people. Nobody in South Africa should go hungry. Nobody in South Africa should sleep hungry. Nobody in South Africa should not even have a little
bit of some money to buy soap, just to wash their bodies, to clean their bodies. And for the women in particular, you can imagine, think about those women who have to go and buy the sanitary pads. They don't even have the money to go and do that. Now that there is that little bit of the 350, at least they can be able to have that decency. It's very little money, but it is something that can be put in their hands. Thank you.
Thanks very much, Honorable Minister. The next question, follow-up question, is going to come from Honorable Hadebe, IFP.
Thank you, House Chairperson. Honorable Minister, has the department decided on an amount that the national grant will be? And how does the department intend on financing the grant? And will the grant be permanent or temporary? And if it is temporary, for how long will it be available to the people? And lastly, how does the department, through the policy, intend to counter the possible exclusion of rightful beneficiaries, as we have seen happen in other social grant schemes? Thank you, Honorable Minister.
Thank you very much, Honorable Hadebe. As I indicated from the very beginning that we are still in the process, our consultation is what is supposed to be helping us with looking at the different options that are possible for this grant. But also let us recall that it's not like we've announced that it's starting tomorrow. There is a due policy process that needs to take place, and ultimately it has to go to cabinet. But of course, one of the things that I wouldn't want to see is to find ourselves back in the same situation when the proposal for the basic income grant presented itself and the document ended up being just lying there in the shelves. And then COVID-19 came and forced us to pull out that document and polish it, because if we say that it was developed as way back as in 2002 and so forth, there's a lot that has changed throughout the process. But what I think is important is the fact that South Africa has got institutional processes which enable us to go through those institutional processes, including bringing things to this house, by the way, because the basic income grant debate was taken to the National Assembly, and the majority of members of parliament supported it because they realized its need and its purpose. And therefore, as to what system is going to be, I am not able to say that, because as I said, we are still consulting with key stakeholders. And as I said earlier on, is that once a draft policy has been tabled to cabinet for consideration, we're hoping that we'll be able to do that before the end of the year. And I'm not giving up on this one, because if you know the state of the people, and if you know how people are suffering, and if you know how much people are struggling, there's no way that we can give up on this one. In terms of how long is it a short-term, basic income grant cannot be a short-term thing. Basic income grant has to be a long-term. And of course, as I indicated, considering continuously where the money is going to come from. And I think that South Africans collectively, they can put their heads together and tell themselves that we can't have children who are going to bed without food. I still insist the state of the people is what must drive us as to exactly how we're going to be able to implement it. With regard to the experiences of people who are applying for it, we've learned our lessons during this time of 350. But also when I look at the broader picture of 10 million people applying, and you end up with probably about 8 million who gets the grant because they qualify, the rest are sifted out by the system because they don't. One of the things that we need to do by the time that this policy is being approved, we need to make sure that we have fixed our systems in such a way that it doesn't become easy for people to just get into the system when they don't deserve to be in the system and they don't qualify. We are looking at improving our systems, and I think if we look at how our systems are working now, 5 years ago or maybe 6 years ago to now, there's a big difference. And I indicated earlier on that we're looking for the best
technology that we can apply in making sure, because we don't want also for people who are the ones who are taxpayers to come back and complain and say, you are taking this money, but you're absolutely doing nothing to protect the taxpayers' money. Thank you, Chair.
Thank you, Honorable Minister. The next follow-up will be asked by Honorable Arnold. Honorable Arnold.
Thank you, Deputy Chairperson. Minister, the basic income grant has the potential to eradicate hunger and also contribute to economic growth.
Order on the platform, order.
Minister, the basic income grant has the potential to eradicate hunger and also contribute to economic development. There has been debates about the introduction of the basic income support since your government took over in office. It is now 28 years later, and your self-proclaimed party of the poor, which has stolen from the poor due to corruption, has not delivered on the national income grant. Now, my question is whether South Africans can take your government serious when it comes to the implementation of the national income grant, and if so, why did you fail to action it in the first place?
Thank you, Honourable Member.
Thank you, Honorable Member, for that question, Honorable Anat. Policies are developed and proposed. And when policies are proposed, they need to go through vigorous processes, including what we are now going through now about whether we can afford it. I think one of the things that made it not to happen was just that big question that is put in front. Can you afford it? Why do we start with the affordability rather than starting with what is it going to do? You yourself are rightfully saying that it has a potential to eradicate hunger. It has a potential for economic development. I truly believe that it does have all that potential. Again, it's lessons learned, because I wasn't a minister of social development for me to have actually at that point in time pick up that there was a proposal of that kind of a policy. But when I realized in asking the questions, what are we going to do after the 350? And it was the officials of the department who have been there since that time, who said, maybe this is the right time. Let us tell you about a proposed policy that we had proposed many years ago that didn't find its way through. It did not find its way through because when we put the question of, can we afford it first before we even get a chance to discuss about what is the potential for it, what would be the impact for it, what would it do in addressing the issues of poverty, in particular the issues of poverty and hunger. And yes, maybe you are right in saying that we were not able to implement it. It wasn't started from 1994. The discussions around it only happened around 2002 going forward. But again, I still think that at that particular time, probably government felt this is very expensive, we can't afford it. Let's not even bother to look at the systems that we might put in place. Let's not even bother to look at options. And the document was there. That's why I said earlier on, it does happen that we develop policies, and in the process of discussing those policies, we find that maybe that wasn't the right time to be implementing them. It's unfortunate because I personally believe that had we implemented it there and then, so many people would have positively affected by having that money in their hands. And it's never too late. I believe it's never too late. And if you are a government, you must be a government that is also able to accept that maybe here you didn't do the right thing, you should have gone on with it. But this is the situation we have right now. What we need to do is to push for its implementation for the future. But at the same time, we're busy pushing for that. We are also looking at how can we improve the performance of the economy? Because if we don't get it in as far as the economy is concerned, if we don't get it in as far as the creation of the necessary jobs, if we don't get it in making sure that the infrastructure development, and all the good projects that we have in place. And if we don't implement those, then there's little opportunity also for us having a bigger purse. As far as corruption is concerned, you are aware of the fact that this government has never gone out to anyone and said, you go and be corrupt. We don't do such things. But unfortunately, we are a community, we are a society, whether we like it or not, across the board. Corruption is a sickness in the system. Corruption is more than just government officials doing this and that. Corruption walks on the street. And my view is if we narrow it just to those ones who are in office, we'll never be able to break it. We need to break it as a system that's denying our people of their rights from service delivery.
Thank you, Honorable Minister. The next follow-up question, the fourth follow-up question is going to ask by Mr. M.R. Baha, DA.
Thank you, House Chairperson. Thank you, Minister, for your response, because my question is mainly on what you've just spoken about. The South African Social Service Agency administers long-term grants to vulnerable and poor in the country. However, your department has been plagued by corruption and fraud on the administration of these grants, with officials in your department pocketing millions, and an additional 1,100 people have unduly benefited from social grants in the country over the last decade, taking at least 540 million rands with them. How will you administer a basic income grant worth billions to approximately 20 million destitute South Africans when your department is actually involved in stealing most of the money that is due to the vulnerable people? Thank you, House Chairperson.
Thanks so much, Honorable Member. Honorable Minister.
Thank you very much, Honorable Member, for that question. Yes, I agree with you. If the rot starts within the system, it means we must look for the best system. I believe that part of what we need to do is to have less human hands going through in the system. If we can have a system where you don't have to have people that, because look, for me, people have to go and sit there in front of SASSA and they are asked questions and they are answering and they're genuine. They're filling up genuinely. Then somewhere along the line, there's somebody else who's sitting there looking and saying, as they are busy filling these forms, I must be able to see how I can twist somebody. For me, it is a question of ethics. The ethics, the capacity of the state. Does the state employ the right people who know that as they sit there, they are not sitting for themselves. They are sitting because they are supposed to serve the people. That's the first thing, which therefore means we need to strengthen our own internal systems of ensuring that we have systems that are not easy to manipulate. If you have systems that are easy to manipulate, which I think for a while, there are some systems that we had in place that were easy to manipulate. Hence, we now have the numbers that you are churning out of 450. I personally believe that when I look at the systems that SASSA in particular, because remember that a few years ago, SASSA was almost the talk of the town in all the negativity and everything. And I think SASSA, the institution and the people who are there have learned. But what I think they've also made them to learn is when the law bites. If the law doesn't bite, again, people take advantage. Right now, the law is biting and people are very sensitive to the fact that if I do this wrong thing, I'm going to be caught. I mean, we were having even an argument about just getting into somebody's computer. What is it that we can do to make sure that if this is your computer, nobody else must come into the computer? What system do you need to put in place that if this computer is supposed to be operated by a Lindiwe Zulu, nobody else, even if they come in the middle of the night, they mustn't be able to do that. And so the lessons that we have learned, including the systems that we have put in place to try and catch these people. You see the figures that have been churned by members all here. One, it is because we have internal audit committees, and we are strengthening those audit committees so that they themselves also, when they find things, they are not have a discussion on the side. Number two, the lessons that there's the internal audit plus the Auditor General. The Auditor General herself and her office, I can tell you, they are vibrant, they are demanding, they are pushing, they are even making sure that ourselves, who are the executive, we don't run away from those meetings. I cannot run away from the meeting of the Auditor General because I need to be able to understand and appreciate, Auditor General, what are you picking up in my system and what are your suggestions for us to fix those? If that can be strengthened and make sure that even in the office of the Auditor General, you've got the right people, right from the top down and down up, if you have the right people, South Africa would be a better place with far less corruption. And by the time we get to the basic income grant itself, I'm sure we would find a better system. And by the way, not long ago, I was in Germany. In conclusion, I was excited to find that they also have the basic income grant. I mean, you would think that a country like that, well developed and everything, they have the basic income grant. Enkosi, enkosi.
Enkosi, Honorable Minister, Minister Sakuba. Question 149.
Thank you.
That have asked by Mr. Moletsane. Free State, EFF. Honorable Moletsane.
Thank you very much. Oh, I was still waiting for the member to ask. I forgot that it's written down.
It's you.
Sorry, Chair. Thank you very much, Chairperson. As at 31st March 2022, our data shows that there were 64 graduates who were unemployed and indicated their availability to accept a 4-month temporary placement in the department as follows: 50 scholarship recipients, 9 recipients of NSFAS, and 5 bursary recipients by the provincial government. Chairperson, I am one of those people who really believe that if we can get people to be permanently employed, is much better. But sometimes we find ourselves in a situation where the budget is not adequate. And so we say, even if we can give them a short period of time, and in the past, they didn't even want us to have that conversation about the short space of time, but we said we'll continue looking for the funds in order for us to make sure that people are permanently employed. And I must actually thank the Department of Social Development in the Free State, because they were among the first departments to get social workers fully employed. And again, this was because we were pushed by COVID. There were just too many challenges that needed that we have much more social workers, and therefore the department had to look around. But also I want to indicate, Chair, that it is our belief that social workers must not only be looking at absorption by the Department of Social Development, other departments have to take responsibility. Again, I'm also of the view that the Department of Education, the Department of Health, the police, they need to have social workers. But I'm also of the view that we have too many social ills in our country. And if we can have more social workers that are placed within our communities, I've been saying to the department, we must do preventative, so that the police don't have to be chasing. If we have preventative programs and using the social workers, I've been advocating for social workers, and I've been saying to deal with these social ills, we need to do these things house to house, street to street, community to community, because then we have social workers who live within the area, who know what the challenges are within those areas. So the numbers that I've just said now exclude social workers who are registered on the database of scholarship recipients. We have also secured employment within the NGO operating within the Free State. And as part of the plans for recruitment of unemployed social work graduates, the department maintains a database of unemployed social work graduates. The unemployed graduates are considered for internship programs as an interim measure. For example, the department recently implemented an internship program for 92 unemployed social work graduates for a period of 3 years until the 31st of March 2025, receiving a stipend of 6,000 rands per month. And if it so happens that they are within this program and they get better employment somewhere else, we would be very happy, because we also look out for those opportunities for them. Furthermore, the Free State province is collaborating and partnering with the National Department and various sector government departments and entities to develop a sector strategy to guide government departments how to employ the social service professions in the public service and government. The strategy proposes a permanent solution to the employment of social service professionals in various sectors, departments, agencies, provinces, and municipalities. And in July this year, Social Development, together with Basic Education, Justice, Health, SAPS, Correctional Services, Defense, and COCTA, presented a joint bid to the National Treasury. The bid is canvassing for additional allocation of 8.2 billion in the first year, 8.2 billion in the second year, 9.2 billion in the outer year, 2025-2026, for the permanent employment of approximately 29,837 social service professionals, ranging from social workers, social auxiliary workers, child and youth care workers, and community development practitioners. We are currently waiting feedback from National Treasury, and we are hoping that they'll be positive, because in order for us to deal with this issue, we need these social workers at community level.
Thanks very much, Honorable Minister. Honorable Muletan.
Thank you, Chairperson of the session. On a follow-up question to the Minister on the issue of the social workers. Minister, when comparing the statistics of last year against this year's of unemployed social workers, has the number of unemployed social workers decreased or it has increased? Please provide the details. Thank you.
Thanks so much, Honorable Member. Honorable Minister.
Yes, thank you very much, Honorable Mulitane. Instead of decreasing, it's actually increasing. And part of the reason why it's increasing is because you have those social workers that have been trained by the Department of Social Development, and sometimes they might be easy to absorb, but you've also got other social workers who really take their own time, their own finances, and they go and train as social workers because they believe in this work, they love this work, they want to do this work. And I'm just generalizing because that's what I know that we feel on the ground. But to the specific of the statistics as to the numbers in terms of increasing, how many are those? Again, that's the information that I will need to get from the provinces, because we don't necessarily absorb them just as national. They are absorbed by all the different provinces. So I'll need to get that data and be able to send it to you if you don't mind, Honorable Member. I will ask the department to give you the specifics, because I think you'd want to also make a follow-up from the province where you come from. But even next time when I come back, you should be able to ask me the question, you said this is the number, what is happening? And I should be able to give you the specifications. I'll get that data from the provinces. Thank you.
Thanks very much, Honorable Minister. The second follow-up question is going to ask by Honorable D.R. Ryder, DA.
Thank you very much, House Chair. Minister, thank you very much for being here today in person. Minister, the Children's Amendment Bill seeks to find a comprehensive legal solution to the foster care crisis in the country, and it's currently out for public participation. In the event that the bill is passed, provinces will need a minimum of approximately 70,000 social workers to efficiently implement that legislation. Currently, the country has got 17,500 social workers. Is there a plan, is there a budget, and is there a timeline to train and employ all of these additional social workers, almost 60,000 additional social workers, to appoint those that are already qualified and not employed, in order that we can effectively solve the foster care crisis in the country with this legislation? And please give us the details. Thank you, House Chair.
Thanks so much, Honorable Member, Honorable Minister. Yes, thank you very much, Honorable Ryder. Yes, there is a plan, as I indicated earlier in my answer, that we have collaborated together with the departments that I indicated earlier on. That's basic education, justice, health, SAPS, correctional services, defense, and COCTA. We presented, this plan has already been presented to National Treasury, and the plan basically is for us to make sure that we ramp up the number of social workers, because 17,500 is paltry if you think about the social ills that we are facing. So that plan that we have now presented is almost like a national plan for us. And the fact that we are also getting a hearing from National Treasury indicates the fact that everyone is very conscious in government of the challenges that are faced in terms of the social ills, but everyone also is in agreement with us that we'd rather put more efforts in preventative measures than to waiting for the time. Here's an example that I keep making, that you have schools which we know have got troubled children in the schools, and you only have one social worker that has to cover all these children. It's really, really not acceptable. And the numbers that we are putting out here, that we need about 70,000 social workers, is not a thumbsuck. It is a number, and it is a figure that the department, working together with this other department, has indicated that we need this number of social workers. And when I talk about getting social workers to be even on the ground on day-to-day basis, in instances where you have so many problems, we should be able, people have to be able to refer, maybe in a clinic or somewhere. People must be able to go and say, I'll find the social worker in this place, this is my problem. Because, by the way, one of the other things that we are realizing is psychosocial support in South Africa. COVID-19 has put too many people under extreme stress and strain, and you need the social workers to be able to deal with that. You also have the issue of abuse in families. You need social workers to be able to do that. One of the things that I indicated to the department was we were able to have during COVID, we were able to recruit young people as volunteers to go and assist us in managing the queues at SASSA and asking people to wear their mask and asking people to keep the distance. And I said to the department, you see, COVID pushed us to a point of starting a program like this one. These people were able to go on the ground. This is what we need. We need to have more social workers, so that on each and every street of South Africa where we know that they are very serious from, we must make sure that in clinics there are social workers that can be able to respond to people. And again, as I said, remember that when I was indicating the departments we're working with, I said the bid is canvassing for additional allocation of 8.2 billion in the first year, 8.8 billion in the second year, and 9.2 billion in the outer year of 2025, 2026. But I also believe
This responsibility of social workers must not be left to government alone. The private sector has got a very important role to play, and we are already going out there and having the conversation with them to say to them, you are going to want the same people to go through university and all and be hired by yourselves. Now you want healthy people, you want mentally sound people to come and work in there. So they have to assist us in the process.
Thanks very much, Honorable Minister. The next question is the third follow-up question is going to ask by Honorable Detroit, EFF plus.
Thank you, Honorable Chair. Honorable Minister, I've been partially covered by the previous speakers. We're currently sitting with some kind of a conundrum. As Honorable Ryder correctly alluded, we need thousands of social workers in the country to tend to the dire need and the situation that we are currently in. But the fiscus doesn't allow for that. We've got the carrot and stick situation where the carrot is there, the job opportunities is there, but there's not sufficient funds to finance that. Minister, in your initial answer, you said that when the graduates come to you for work and they do apply, government also look at other opportunities of employment. Could you please elaborate on that and tell us more? If there is a graduate or someone that is qualified that isn't employed or can't be employed by government, on which database must they then apply to be assisted by government to find employment in the sector? Thank you, Minister.
Thanks, Honorable.
Thank you very much, Honorable Detroit. I believe as South Africans, we can be creative, we can be innovative. We cannot be found lacking on just being innovative and creative. And that's the reason why I'm saying that the database that we have, and by the way, may I clarify this now that you've raised this issue. And there was a time when we spoke about the employment of the social work graduates, and we indicated that the graduates were graduates, they were coming out of the Department of Social Development. And there was an uproar that was saying, but now we are only focusing on your own. Let me make it very clear here. It is not about us finding employment only for those that have been trained by the Department of Social Development. Every social worker for us counts, as long as they have the necessary qualification and they went through the proper schooling and qualification. We want the database that we have of social workers is more than the social workers that have been trained by the department. But I still think that even if the fiscus is not allowing us, we need to be able to find a creative way, because we cannot afford to have the kind of social ills that are breaking our communities, that are breaking families, that are breaking young men and women, that are breaking young girls. I mean, those girls, those children, for instance, who died in a tavern. Why must we be having that? Why must those children be in a tavern at that hour? You have a 13-year-old who is in a tavern at that hour. You ask yourself the question, the schooling system, is it enabling to make that child make the decision? The home system, is that home system enabling the child to be able to know that I cannot be found in a place like that? Is that system, the systems that we have in South Africa in bringing up our young children, is it enabling for them to be able to make the right decision? I belong to an international organization called She Decides. And my passion for it is, I cannot be talking about a young girl deciding only because now she's going to high school or she's going to university.
She must be enabled right there in the home to be able to make the decision. But here's the catch. The catch is that the parents themselves must be the parents who are able to decide, because these days, these children, the parents talk to them, don't go there, they don't care, they leave, they sneak out, they go, well, the things that we did, but not as bad as the situation is right now. So I believe that we need to be very creative in making sure that the graduates, both those that have been trained by government and those that have decided on their own that they want to be social workers, we have the database as the Department of Social Development. It's just that we need to make sure that this proposal that we're putting in place for the employment of the social workers must be all-encompassing and not isolating only the ones that have been trained by the department. Thank you very much, Chair.
Thanks very much, Honorable Minister. The next follow-up question is going to come from Honorable M.E. Chabelin. Honorable Chabelin.
Thanks, Chair of the session, and thank you, Minister. I'd like to know, I mean, you know, looking at South Africa now, we're facing very serious psychosocial challenges. As you rightfully said, that COVID has added more strains on the problem, on the challenges we had. So which means our challenges were ×2 when it came to COVID. But then we've got people who can make life easier for those who have challenges of psychosocial diseases or challenges, as I would like to refer to them. But then we cannot, we have people who can help us, but we don't have money to hire them. But if you look at the budget of the department and see how much money goes into NPOs, and some of the NPOs, part of their mandate is to deal with psychosocial challenges in society, both in education, it could be in health. As we checked just some days ago, it was International Mental Health Day. And those NGOs had lots of programs that were running. Is it possible, Honorable Minister, that the NPOs that we are funding to help deal with the things that the department cannot do, is it possible that we can link our funding to employment of some of these social workers, even if it is for temporary, relief for that time? That's my question. Otherwise, you have dealt with. Yeah, thanks a lot.
Thanks, Honorable.
Thank you very much, Honorable Nchabeleng. We fund NPOs to the tune of 82 billion per year. And these NPOs are the NPOs that are supposed to be, I might not be using the right language, to be an extension. They are not an extension of government as such, but they are organizations that are on the ground, that are, one, supposed to appreciate the demands and the needs of the communities where they are. Two, supposed to use the resources that they get from government for ensuring that their work has got a positive impact on the people. And the good thing about the Department of Social Development is that we're not only just giving the money, we needed also to look at the NPOs who want to do work but do not have the capacity. And therefore, that's why we have a program of a training of NPOs, so that, because you can't run away from the fact that there are NPOs of the past. We had a long experience of being able to account, of being able to develop proper programs. Then in our communities, we had NPOs that never had that experience, and you can't ignore them. You've got to make sure that they are empowered in order for them to be able able to support our people. And this issue of mental health, I think it's one of the biggest challenges we have in South Africa. Because even in our communities, the recognition of mental health was not an easy thing, but I think it's beginning to be understood and appreciated now, especially because you have NPOs that are now dealing with, you hardly even had NPOs that were dealing with the issues of mental health for our people. And it wasn't fashionable anyway. But now the issue of mental health, and especially because of the impact of COVID-19 and how many people lost a lot, either their homes or their livelihoods and everything, and many of them need this psychosocial support. And the department cannot cover all these people. Even in the provinces, they can't cover all these people, but they can be covered if we go back to the issue of increasing the social workers. But even within the social workers, you need to make sure that it's not just a social worker. It's got to be somebody that also knows how to deal with particular cases of people that are going through this, of mental health. We also don't have enough institutions in South Africa that can be able to bring in some of these people and help them through the process of healing. And I think that we can also mobilize within the churches, with other non-governmental organizations to make sure that we pick up this issue of mental health and make it a serious problem in South Africa that does not only just belong to issues of the Department of Social Development, because there are clinical psychologists that you need. There's a whole range of specialties that you need to deal with psychosocial challenges as well as mental health problems. We don't have enough people. And as a department, I also feel that we don't have enough monitoring and evaluation of the very institutions that we are supporting, although of late we've been calling upon them to raise their hands and talk to us so that we can be able to assist them. We believe if they are organized and they're doing very well, they are specialized, they can do a lot of the work that government needs to do in supporting our people. Thank you, Chairperson.
Thanks very much, Honorable Minister. Siyakuba. Siyamanje ku question 152 that have asked by Honorable Christian, Northern Cape, DA 152.
Thank you. Thank you very much, Honorable House Chair, and thank you to Honorable Christians for the question. The issue of children living and working on the streets is a matter that I have directed the department to have a closer look into. There are a variety of reasons that make children to end up living and working on the streets, such as family problems, violence, conflict, abuse, neglect, and exploitation. Children living and working on the streets are classified as children in need of care and protection in terms of Section 150 of the Children's Act 38 of 2005. However, we have learned over the years that we need more than legislation to address this complex issue. For this reason, we are working with various civil society organizations focusing on early intervention and prevention, including parenting and family strengthening programs. As you are aware, the Department of Social Development is also responsible for the well-being of its people, but also families. We've got programs that need to focus on families. And I wish to address the issue of timelines for removing homeless children from the streets. There are no set timelines, as this is a continuous process determined by circumstances that each individual child finds himself or herself in, which has driven them to be on the streets, as well as continuous interventions rendered to ensure safety and well-being of children, instituting child protection measures to assist the child. Quite frankly, if you talk about timelines, there's no timeline that I can point to in the department. But as I said earlier on, as a Minister of Social Development and my department, the well-being of our people is of utmost importance, and therefore the state of the people, and that includes the state of the children, is of utmost importance. you know, we are responsible obviously for the children, but it gets very complicated because you are dealing with children who belong to families, who belong to communities, and then the trouble starts within the community itself, is when you need the communities to rally around in terms of the programs that we have as a department, but it cannot be just the programs of the Department of Social Development. Health is important here, education is important here, and local government is important here, because I recall very well during the period of COVID, when we had the homeless and everybody was now scared that, you know, the homeless people are out on the streets and we have lockdown level 5. And we were requested to round up all these people and keep them in special places. And it was funny how we were very quick in finding those homes, in finding those people, those places where we could keep the people. And I was saying to the department, now that it looks like COVID is kind of like going, these people are back on the street. I don't think it is correct for us to have been able to do what we did during COVID and not learn lessons from that time of COVID, and then make the statement that it's our responsibility overall to remove people from the street, reduce, because, you know, sometimes some of them, as I indicated, why they leave home, you keep on removing them and taking them to special shelters. Some of them will stay there, will be assisted, but they end up going back to the street again, which therefore again means there is a problem in how we are managing at a community level in empowering our people to avoid having their children out in the street, which means we must deal with the abuse, deal with the violence, deal with the breakdown of families in general. The relevant details of the plans to remove the homeless children from the streets are prescribed in the Children's Act, Section 151 and 152, which provides for removal of child with or without a court order. The process of removal is informed by safety and risk assessment process undertaken by the social worker, considering safety, risk, and other factors. There we go again. We need more social workers, because again, these children have to be taken through that process, understand why they left home, understand why they are on the street, but also understand what is their hope for a future, because you can't take it for granted that when they are on the street, they don't have any dreams. They all have dreams to get out, but also the abuse and alcohol abuse.
To conclude.
As I conclude, alcohol abuse and drug abuse is one of the biggest challenges that we face. We just returned from the Northern Cape, and what you see there on the street is very painful.
Ngiyabonga, Honorable Minister. Honorable Christian.
Thank you, House Chairperson. And Minister, thank you for your response to that question. I agree with you 100% that homelessness must be dealt with comprehensively with all spheres of government. And again, you know, I'm in total agreement with you as far as the drugs and the crime and the sexual abuse is concerned. It's a huge problem, and I think one that must be dealt with in the country. Now, Minister, children living on the streets become involved in drugs, as we've said, in crime, sexual abuse, trafficking, and other inhumane conditions, such as a deterioration in their health and a lack of education. Has the department made headway with a study on homelessness that was conducted this year? And has the department started on a national policy, which is currently non-existent in this regard? Yes. Thank you, House Chairperson.
Thanks so much, Honorable Member, Honorable Minister.
Yes, thank you very much, Honorable Christian. Yes, the study is very important because we need to speak about facts, and we can't say we cannot have those facts. We have started that study, which, by the way, was also informed by the fact that we looked at the homelessness and we realized that homeless people didn't seem to have a place. When you call this department, they say, no, it's us, is a local structure. We ended up as a department saying what will help us is to make sure that we do a study on homelessness. And there's that section that specifically has to deal with children who are homeless and children who are out on the streets. We're hoping that this study will result in a process of legislation. And I know sometimes those processes take too long and yet people are out on the street. But we need the empirical evidence so that we can be able to take the process forward of legislation. Thank you.
Thanks very much, Honorable Minister. The next follow-up question is coming from Honorable Mukause.
House Chairperson, I'm going to take that question. Thank you. The socio-economic conditions that give rise to child homelessness are complex and have remained largely ignored with not much impact by your department. Do the plans which you refer to, Minister, also include multi-sectoral approaches to address these conditions? If so, please give us the details. Thank you.
Thanks very much, Honorable Member. Honorable Minister.
Thank you very much, Honorable Member. One of the things that we have identified as government is the uncoordinated approach to some of the work that we do, and hence the need for us to speak to other departments and make sure that not only government, but other sectors that are very relevant for dealing with this issue of children on the streets. We in the process of the research that we are talking about, we're not doing research for the sake of research. We're doing the research also because we need, one, the empirical evidence, but two, we need to be able to round up the different sectors that are very important for us here. So again, the issue of social security is one, the issue of safety is another one, the issue of education for these children is another one, but also just even the shelters where these children can be kept. You cannot do that on your own as government. You need a multi-sectoral approach, and the multilateral approach also must not ignore the parents. It must not ignore the churches. It must not ignore the NGOs and NPOs, some of whom I indicated earlier on do get financial support from government. Definitely, Honorable Member, we need to develop the multi-sectoral plan, but obviously that multi-sectoral plan will come out of the research that we are doing. And I'm not wanting also the research to take forever. We need to be quick because we just have too many children that are out on the streets. And again, these are the children who are exposed to the issues of drugs, exposed to abuse, exposed to all kinds of social ills. And in short, I want to say, yes, we need to have a multi-sectoral approach to dealing with this issue. And we do need to involve families. We do need to involve, as I said, churches, but we do also need to involve other influential people that can be able to assist us, including the private sector. Because remember earlier on, I was saying the private sector will want healthy people. The private sector will want people who are stable. So if they cannot help us with this problem right at the beginning of it, when children are still children, and get the children to be in places of safety if they are not home, the best prize is to keep these children at home. But if it comes to a push, then we have to take them to some center where they can be secured and taken care of. Thank you, Chair.
Thanks very much, Honorable Minister. The next follow-up question is going to ask by Mr. N.M. Khatebe. Honorable Pungan.
Thank you so much, House Chairperson. Honorable Minister, you've partly touched on what I'm about to ask. I wanted to ask whether the department has engaged with non-profit and community-based organizations to assess what kind of intervention is needed from the department as a long-term goal, and what support are they offering to these organizations in the interim, if any. And lastly, does the department currently have any initiatives and programs in place to tackle homelessness, and what are the marketing strategies in place to ensure a wider and impactful outreach to the children who are homeless. Thank you, Honorable Minister.
Thank you very much for that question. We do have the strategy and guidelines for children living and working on the streets. And we are developing it to give guidance on the services and programs to be rendered to children living and working on streets. And it has outlined some key interventions to bring all role players, as the other honorable member was referring to, a multi-sectoral approach. So it has outlined some key interventions to bring all role players to realization of a better service for these children. The process of developing this strategy and guidelines was a joint venture between government and civil society organizations, led and coordinated, obviously, by the Department of Social Development. Some of these services include placement in alternative care facilities, such as child and youth care centers, where children can continue with their education and receive social work services, and drop-in centers that provide shelter. We also have the Child Support Grant, which was introduced specifically to support vulnerable families to support and care for their own children and prevent children from living and working on the streets. And honorable member, it is ongoing work until such time that we eliminate this problem. And the only way we can eliminate this problem is to make sure that when we work with families, and by the way, families in South Africa today might not necessarily be the same old way of the description of families. We also have some families that take children in. That's why we try to look at how do we support those families that take the children in. The intake is very low from that point of view. And the initiatives that I have indicated, in my view, are not adequate if you consider the number of children that we are finding out on the streets. So it's about upscaling, firstly, the discussions and engagement with the NPOs, but also upscaling even the initiatives that we currently have. It's also for me about working with other departments. You know, if you think about some countries that have special places where people go, and then you get people from the military coming and engaging with them. You get teachers coming to those. In some countries, actually, people volunteer to go and assist in those. South Africa needs more and more of those that are organized, where people can feel safe, because again, we have the problem of abuse. Sometimes children face secondary abuse. You think you've taken them to a place of safety, only to find that they even get abused in those centers. So it's a question of strengthening those institutions and making sure that we upscale on the initiatives. But again, for me, the best is, can we have these children in proper homes, safe homes? And can we have these children, can we have abefundisi, or, you know, the church is also taking active action, being active in terms of helping their communities in making sure that they appreciate and understand that a child needs to be at home and not on the street.
Thanks very much, Honorable Minister. And the fourth follow-up question is going to ask by Honorable Nkosi.
Thank you very much, Honorable House Chair. Honorable Minister, thank you very much for your response to the question. Honorable Minister, what measures does the department undertake to protect the rights of the children in streets? Thank you very much, Honorable House Chair.
Thanks very much, Honorable Member, Honorable Minister.
Thank you very much, Honorable Nkosi. Firstly, let me just make the reference to the fact that we have a constitution, which is the guiding document that we should all be proud of, but also the provisions of Section 9, 10, and 150 of the Children's Act 38 of 2005 are the basis for the department to ensure that children's rights are not violated. Social workers apply the principles of the best interest of the child, Section 9, and the child participation, Section 10, during assessment of children's circumstances to determine possible reunification with family or removal from the streets and placement in child and care centers. The assessments include participation by the child to ensure the child understands the risk involved by being in the street and the importance of best interventions to address identified needs which led to the child being on the street. When a child refuses to be either be reunited with the family or be admitted into a child and youth care center and insists on remaining on the streets, the social worker institutes child protection measures such as removal of the child or applying the principle of best interest of the child. And I know, Honorable Member, that it's easier said than done when you have some of these children who already have been on the street for this long and they are abusing drugs in particular. We take them to the drug rehabilitation centers. But again, there is a repetition. In fact, one of the issues that was identified now that we had the imbizo with the president, some of the community who spoke there were saying the kind of drugs that are being used now are very different. And therefore, the kind of treatment that we are giving in some of these rehabilitation centers is no longer as effective because they were developed at a particular time when the kind of drugs that was there was understood. And they were asking us that we must now have a greater appreciation of the type of drugs that are being produced and given to these youngsters on the street in such a way that when we take them to the rehabilitation centers, the people who are working in the rehabilitation centers need to be conscious of the current challenges and the new type of drugs that are there. Thank you very much.
Thanks very much, Honorable Minister. Siyakuba Minister. Now we're on 138 question that have asked by Honorable Domain. 138. Eastern Cape.
Yes. Thank you very much, Chairperson. The provisions of the social relief of distress, which is normally just called SRD, is strictly administered in terms of Social Assistance Act. The SRD procedure manual was compiled jointly between the Department of Social Development and SASSA. The procedure manual distinguishes between two main forms of SRD, namely the COVID-19 SRD grant, which is the 350, targeting individuals with insufficient means and SRD disaster for persons or households which were displaced on account of disasters. And we saw recently, Chairperson, in fact, one of the disasters that is consistent and continuous is that one of fires that happen in different places. We know that every year in the Western Cape, we are going to be confronted by these disasters. And now, of course, the biggest one that is now affecting us is related to climate change and the fact that we have torrential rains that wash away homes and houses. So there's a difference between these two. SASSA has launched a digital application platform for eligible individuals to lodge their COVID SRD applications. This ensures that all qualifying individuals can apply for and access the grant, thereby insulating such individuals from any political interference. In addition, individuals or households displaced and accommodated in shelters or community halls because of the disaster also qualify for humanitarian relief provided by SASSA. The provisions of relief is subjected to a verification / confirmed list issued by the local authorities. Thank you, Chair.
Thanks very much, Honorable Minister. The first follow-up question is going to ask by Honorable Ndongeni.
Thank you, House Chairperson. Thank you, Honorable Minister, for your response to my question. How are households and individuals identified for disaster assistance? Thank you, House Chair.
Thanks, Honorable Member. Honorable Minister.
Thank you very much, Chairperson. Because the response also is done by the province and local structures. We are relying on not only lists that are given to us, but we physically present ourselves as the Department of Social Development to the areas that have been affected. We're doing that because we're trying to avoid a situation where there is a fight, where we get lists and then some communities come and say, but how did you get this list? This list is made out of people who are belonging to this political party or that political party. What we decided to do and engage both with the local structures as well as the MECs, we also engage a lot with the NPOs again. The NPOs and NGOs that are almost like our extension, we rely on them because we learned the lesson at some point, especially during COVID time, where there were claims that some either officials or councillors that end up giving lists that are favoring certain parts of the community. And we don't want that to repeat itself. Part of the reasons why also we go physically to the people who are displaced in the halls to go and engage themselves and engage not only with the leaders, because some of them, they come into there, you place them in the halls and then they decide among themselves that they want to be unified, they want to be organized, and they'll choose people who would be the ones who are the people to engage with government. But also we have open discussions because I have, as a minister, and I know that the DM also has done a lot of this by being visible, by being there where the disaster has happened, so that we don't remotely think people have received what they deserve to receive. And it's very strenuous for us because to be in KwaZulu-Natal and then the next thing you wanted to in the Eastern Cape, the next thing you wanted in the Free State, it is very strenuous. But one of the reasons why we stretch ourselves to that point is because we always want to make sure that the right people get the right support. And also the fact that SASSA now issues even vouchers for some of these people, it helps in a way because then they are able to go and buy what they themselves need than to be always relying on food parcels that are being given to them. But of course, there are other communities who are far-flung who would need us to make sure that we deliver these food parcels. We work through the NPOs, we work through locally based organizations, and we rely a lot of them. And it's at this point also that I do wish to thank some of the non-governmental organizations who are always there. Sometimes they're amongst the first to reach the place, and sometimes they're among the first to give the necessary support. But of late and all the disasters that have happened, I can tell you, everywhere we have been, we've been told in the provinces that the Department of Social Development is always the first to arrive in these places, because we beyond just fixing the structures, we also about ensuring that we do the psychosocial support, because the first thing that happens when people's home has been washed away, they break down, and before you can even then think about how you're going to replace that, you need to take them to the shelters. And the Department of Social Development in all the provinces where this disaster happens, they are always the first to step up. Thank you very much.
Thanks very much, Honorable Minister. The second follow-up question is going to ask by Honorable Aplein.
Thank you very much, Chairperson. My apologies for the video. My network is very poor. Minister, it is well known that the ANC ward councillors and other catered deployees use social relief interventions along party factional lines. Will the guidelines that you just mentioned, Minister, include consequences for anyone who uses such interventions in a manner that excludes some community members who are viewed as not supporting a party or a certain party or a certain councillor? If so, please provide us with details. If not, can you tell us why not? Thank you very much.
Thank you, Honorable Member, Honorable Minister.
Thank you, Honorable Aplein, not in my space, not where I am responsible. not where I am aware and I'm sure that there are facts that are on the table. Even yourself, Honorable Apleni, if you are aware of such action that you can send to us, would appreciate to do that, because when I say not in my space, it does not necessarily automatically mean that I'm going to be everywhere. I can't be everywhere. One of the reasons why we started curbing actually this distribution of food parcels and giving them to different local councillors, we were reacting and responding to the very same issue where it was said that some of our own use that, is almost patronage, if I can call it. They use it as patronage. So we've been trying to look for systems where everything can go directly to the people, because if it goes directly from the people and it comes either being delivered by SASSA or being delivered by in partnership with the NPOs, because we've got a lot of NPOs that we work with. I think that to a very large extent, even it's been a little bit quiet in comparison to the beginning of COVID-19, where this was highlighted as a problem. And we took action about it and made sure that we do not have people who are coming to get the food parcels because they want to take them to their own constituencies. The guidelines were developed for purposes of trying to assist us in that. And I personally don't believe that people must go and be voting for any person because that person has brought them a food parcel. It's just an insult to the people, quite frankly. I think that if there are those who have done that, and I don't want to generalize because I don't think it is fair to generalize on the other hand. I know that there's lots of councillors who really do their best to make sure that they serve the people, but probably amongst them you'll find one or two who would behave in that way. These guidelines are guidelines that are meant to assist us to cushion our people against that kind of abuse. And the consequences, obviously, for that is if we have the facts and the figures and everything in front of us, we would have to then take action because, as you say, these are people who belong to the political party called the African National Congress. The African National Congress has also got its own consequence management in as far as this is concerned. So if you have specifics, Honorable Apleni, I'd gladly have that information and we can act on it. Thank you.
Thanks very much, Honorable Member, Minister. The third follow-up question is going to ask by Honorable Toit.
Thank you, Honorable Chair. Honorable Minister, you're well aware of what transpired earlier the year with the floods that took place, mostly in KZN, the Eastern Cape and the Northwest Province, and where food parcels were distributed by your department. The unfortunate truth is that the amounts that was paid for these food parcels were not the same in the different districts and not the same in the different provinces. Minister, what would the reason be for this if your department identified that the need for a person or a family is A and B, C, and D is being paid in such an event? Thank you, Chair.
Thanks so much, Honorable Member.
Thank you very much, Honorable Toit. One of the challenges is about the service providers. When people get an opportunity to get a contract to serve the people and then they make differences, the food parcel is not the same as in another province because you got a service provider who said this is what he or she was going to do. And then when they get there and they have the opportunity, then they try to reduce. That's why I said earlier on, part of my discussions with SASSA was, can we re-look into this whole thing of food parcels? Can we re-look into it? Because sometimes we might need to give people vouchers where they can go and buy the kind of food that they want. Because if you give them the vouchers and then you make sure that you lock in the voucher so that it doesn't end up going to
buying alcohol and other things that are not necessary. And it is possible to have issued those kind of vouchers that can also just tell them that you will only use this voucher if you go to this wholesale place to go and buy, or this commercial center that you might want to buy. We are looking into the impact of it. In fact, SASSA did start implementing that issue of the vouchers, but again, you implement the vouchers and then you get other clever people out there, they take the voucher, they give it to somebody else, they take the money, and it just becomes one difficulty. And for me is the consciousness that we all collectively need to raise. It cannot be a consciousness of the political people or the officials. Let it also be a consciousness that is raised amongst our people, because you can't have people who don't have nothing. Then they get the voucher and then they go and use the voucher for something else. Those are just some of the things that we need to work on. But SASSA is looking at other options that can be, one, efficient, and two, that can have people being able to buy the necessary foodstuffs if they have to buy the foodstuffs. Sometimes you give people their food parcel. Then in fact, when I got to the department, I was like, who said Black people must only eat these baked beans and samp? And then I get to KwaZulu-Natal, I find people who are supposed to be making uputu with meal, they are being given the samp, and then you go to other places. You know, it's a mixed masala that I don't think must not, because we must be conscious also. Yes, we want to have nutritional or nutritious package of food, but we must also not take it for granted that our people cannot be able to decide for themselves. I don't think so. I think if we assist them and help them to make the right decisions about this money that's being given, this voucher that's being given to them on the basis that they have had the problem, and also I believe we must make the people to be the ones that are the guard. They must be the ones that police each other about some of these things, because if we think we're always going to be there to police them, I also don't think it is a correct thing to do. So the entire system that SASSA has been using, SASSA is really looking at what are the most creative, most innovative. But lastly, there's also something very important. I've said to SASSA, this money that comes from government is a financial muscle which is supposed to also help your small and medium enterprises and your cooperatives in the township. Can we let the money also to circulate within the township so that at least the people can begin to feel that they have the money, but it is circulating within the communities? Thank you, Chair.
Thanks very much, Honorable Minister. The last follow-up question is going to be asked by Honorable Laxkachen. Mama.
Thank you, House Chair. Minister, yes, I think there's a lot to be said about food vouchers and a lot to be sorted out. But in the meantime, considering that the distribution system for providing food parcels to the vulnerable is so easily manipulated, as you already alluded to yourself, as well as the fact that the department is relying very strongly on local structures, will the minister and the department consider additional funding to NPOs and NGOs to assist with the distribution, or alternatively increasing the SASSA grants?
That's very interesting. That's very interesting. It's very interesting. You know, as I indicated earlier on, that the experience of COVID-19 and the fact that we looked at this outcry where people were saying that, but why is this food going this way instead of going that way? It's then that the CEO of SASSA and myself thought about it and said, let us look deeper into the distribution system, because if you don't fix the distribution system, you'll have consistent problems. In fact, I think that
remember earlier on, I don't know which question was I answering, where I was saying, whenever there's human beings, sometimes in between, there's an opportunity for them to manipulate the system. You need to make sure that you lock the system up so that it doesn't become easy for people to do that. See, the vouchers that we've been giving to people is also not, I think it's 1,000 something, I can't remember exactly. When you say, don't we think about additional funding, I actually didn't think about that. And that's why I'm saying this is a very interesting proposition that can be put in front of us. And one of the things I like is the fact that in our conversations with all these people who are getting the SRD, many of them have been telling us, especially in KwaZulu-Natal, they've been telling us we can contribute to you finding better solutions than the solutions that you work out sitting in Pretoria. We know what is happening here. We have our own leaders here. We can make contributions and tell you how it works. In fact, they were saying they can even tell us which of the NPOs that they've been working with are very honest NPOs who do not take the money for themselves, but they are very sensitive to the need of the people. So thank you very much. I think this is a good contribution. That it's a question, but I think I like it because I think we can add it as one of the discussions we have with the SASSA.
Thanks very much, Honorable Minister. That conclude.
Oh, thank you.
The question, Honorable Delegate. I would like to thank the Minister, MECs, all permanent and special delegates for availing themselves. Honorable delegates, that concludes the business of the day. The House is adjourned and the buses are waiting for us outside. Thank you.
Thank you.
Thank you, Mama.
Thank you,
Mama.
Thank you, Mama.
Thank you.
Thank you.
Thank you, Mama.
Recording stopped.
Minister, can you please tell the police we have the house so much better?